Moved and seconded. All those in
So
favor
moved.
signify by saying aye.
Aye.
Oh, you want to do a roll call?
Yeah, you gotta do the roll call.
Roll call.
Aye.
Aye.
Chairman Craven.
Aye.
First Vice Chair McEntee.
Aye.
Second Vice Chair Knight. Representative Agello. Representative Batista.
Aye.
Representative Agello. Okay. Representative Bennett.
Aye.
Representative Caldwell.
Aye.
Representative Casimiro.
Aye.
Representative Corvese.
Aye.
Representative Felix.
Aye.
Representative Lombardi.
Aye.
Representative Norrie.
Aye.
Representative Place.
Nay.
Representative Roberts.
Aye.
And Representative Wilkinson. Was Representative Roberts, was that a nay?
Yes, it was.
Okay,
Aye.
thank you.
Roberta, I'd like to vote aye too. It's Representative Agello speaking.
Okay, thank you.
Thank you.
The ayes have it.
Okay, we have held all bills for further study. The first bill I want to deal with tonight is the second bill on the agenda. We have the sponsor here in our presence. It's House Bill 5376, sponsored by Representative Donovan. It's an act related to health and safety. Balloons prohibits the release of balloons inflated with lighter than air gas, subject to a $250 fine effective November 1 of this year.
Thank you, Chairman Craven and members of the committee. This legislation is modeled after legislation passed in New Jersey and Maryland and would ban the intentional release of helium balloons into the air. It does not ban balloons altogether or punish an accidental release. Why is this necessary? Balloons pose a significant threat to wildlife, cause dangerous and troublesome power outages and fires, and can be a nuisance to commercial fishermen. Each year, stray mylar balloons, which conduct electricity when they come into contact with power lines, cause power outages that leave thousands of homes without electricity for hours. During last year's drought, a cluster of mylar balloons collided with a power line, igniting and starting a dangerous brush fire in New Hampshire. All released balloons, including those falsely marketed as biodegradable, end up as hazardous debris littering our waterways and landscapes. Land, air, and sea creatures attracted to a balloon's vibrant colors mistake it for food. Some of these creatures, stomachs filled with plastic debris, wash up on our shores. Some are found tangled in string hanging from trees. The pictures of these mishaps are hard to ignore. But I want to bring your attention to a letter sent to us by one of my constituents, Kenneth Murgo. As a commercial fisherman, he is also a small business owner. I'll read just a portion of what he writes. In my fishing operations, we fish traps in order to catch lobsters, crabs, fish, and whelks from our local waters. Each fisherman has a color scheme for their buoys that mark the location of traps. I spend a lot of my day using binoculars to look for buoys, and they're very often mistaken, and very often mistake brightly colored balloons floating on the surface of the water for my buoys. He goes on, in between Memorial Day and Labor Day, it is not uncommon for me to see a dozen balloons on the surface of the bay in a single day. Once these balloons deflate, they sink to the bottom, where they get tangled in my traps by the plastic string trailing from the pop balloon. I often bring up other plastic pollution this way, commonly plastic bags, monofilament fishing line, plastic cups, etc. But out of all this debris, balloons are the most common by far. He concludes his lengthy letter with this. Fishermen are unfortunately all too familiar with the perils of overregulation. I am here to tell you this regulation is needed because the problem is real, and until Rhode Islanders understand that releasing a balloon is unacceptable, the problem will persist. I urge you to read his letter in full. I'd also like you to view, if you have a chance, the video that I sent you today. It comes from a gentleman who was here last year testifying on this bill, another fisherman from South County. While he was here, he was awaiting a double lung transplant, and that's where he is right now. He's recovering from a double lung transplant in Boston. And he made that film knowing he probably wouldn't be here to testify this year. But it's quite telling, and he has a story to tell, so I really urge you to look at it. So members of the committee, with passage of this bill, we could bring awareness to the consequences of balloon release and halt the practice at the events where they would likely take place. Each violation would be punishable by a fine. The release of multiple balloons at once would be considered a single offense. The fine would be a deterrent to the practice. This bill has widespread support from utility companies, offshore commercial fishermen, environmental groups, and the Rhode Island Department of Environmental Management. And I urge you to consider passage. And I can take any questions if you have them.
Any questions for the sponsor? Yes.
Thank you, Chairman, and thank you, Representative Donovan. This is a great bill. As a state rep from Narragansett and South Kingstown, I remember the testimony from last year of the fisherman who, I hope he's doing well with his lung transplant. But all of the fishermen down in Narragansett have lodged many complaints about the balloons and the damage it's doing to getting caught up in fish and traps and this and that. So I think you have a lot of support from the fishing community in Galilee. So that's a big, you know, that's, I believe it's like $1 million industry in Rhode Island, if not more. And we want to make sure we keep that industry alive and well. So thank you for bringing this bill. I think it's a great bill.
Thank you.
I have a quick question, Mr. Chairman.
Okay, you might go ahead.
Sorry, I think I lost my, I can't hear anything, so can you all hear me?
We can hear you now. Thanks.
All right, perfect, thank you. Representative Donovan, I just have a quick question in terms of, is there anything in the bill or anything that you foresee in terms of promoting this or letting folks know, maybe is there something in regards to waiving the fee? I'm just concerned in particular because for a lot of communities, the releasing of balloon, and I definitely understand the concerns when it comes to environmental and our animals, which I absolutely love. I'm just concerned with many of our communities who do balloon releases for the passing of a family member or in terms of a celebration. So is there something in regards to educating our communities before this bill goes into effect to ensure that our low-income communities in particular are not hard hit by this bill?
Yes, I hope so. I hope to have a conversation with the DEM about that. But that's exactly what we're trying to stop, is having these mass balloon releases at memorials, at weddings, at sporting events. That's where you're seeing the mass release of balloons. But I think once we have a law in place and people understand that, you know, what we're trying to accomplish here, I think it'll work out. But first we have to have the law and then have an education campaign.
Dave, please.
Thank you.
No, Mr. Chair, I just wanted to echo Vice Chair McEntee's comments about, you know, the legislation itself. For those of the committee that didn't get a chance to hear this the last 2 years, the testimony is very compelling. Is it Norbert Stamps?
Norbert Stamps.
Norbert Stamps. He's the one that made the video and having the lung transplant right now. I mean, again, it was exceptionally compelling testimony, and to be perfectly frank, it changed my opinion of the legislation 2 years ago, and you know, I'm definitely in support of this legislation going forward. So again, those of you who didn't really get a chance to hear the full depth of the testimony, it was definitely impactful, and you know, coming from probably the person who least likes regulation in the room, I'll definitely support this legislation.
Yeah. Mr. Stamps was president, or maybe he still is, of the North Atlantic Offshore Fishermen's Association. He also is on the board of the Maine research board for lobster in Maine. He's very well known and he's very well respected. And he had lots of conversations with me about regulation, but this is something he feels very strongly that we should regulate.
Any further questions of the sponsor? Seeing none, we'll go to the call-in testimony. The first witness is Maya Jones. Maya Jones, you're on the air before the House Judiciary Committee.
Good evening, Chairman Craven and members of the House Judiciary Committee. We are Girl Scout Troop 113 from South Kingstown. There are 6 of us, ages 10 and 11. We are here today to ask you to pass the balloon release ban. We are working on our Girl Scout Bronze Award, and we are committed to accomplish something that will help the community and or the environment. We support the balloon release ban because even in Little Rhode Island, thousands of balloons are released every year. The litter from balloons contributes to plastic pollution in our oceans, which kills 100,000 marine animals a year. The animals die because they eat the balloons and choke or get trapped in deflated balloons or strings. There are many other alternatives to releasing balloons, like blowing bubbles or flying kites. If we pass this bill, we can set an example for other states and join the states that have already made the commitment to protecting animals and the environment. Virginians recently passed a similar ban on February 18th. We also have a presentation that we included with our written testimony. Thank you. By Avery Moniz, Hayana Rivera, Imogen Foy, Kezia Dahl, and Tazlin Madison.
Thank you, Maya. Any questions for Maya Jones? Seeing none, the next witness is Kevin Budres. Kevin?
Yes, this is Kevin.
Hi, Kevin. My name's Bob Craven. I'm the chair of the Judiciary Committee, and you're on live. You can go ahead and testify.
Thank you so much, Chair Craven, and thank you, members of the committee, and thank you especially to Representative Donovan for once again introducing this important legislation to prohibit the intentional release of balloons. My name is Kevin Budres, and I'm an attorney with Conservation Law Foundation, or CLF. CLF is a member-supported nonprofit organization that works to protect New England's environment for all people. CLF supports House Bill 5376. By banning intentional release of balloons, this bill would be an important step in keeping an especially problematic form of single-use plastic from injuring and killing our wildlife here in the ocean state. Many balloons, of course, are made of plastic. And several recent studies have shown that balloon debris in our oceans poses a significant risk to wildlife. In particular, a study from 2018 in Australia and New Zealand found that of all the marine debris consumed by birds, balloons were the most likely to be deadly. And in fact, the study showed that birds that had ingested balloon fragments were 32 times more likely to die than those that had ingested hard plastics. And the impact of hard plastics pollution on marine life is already bad enough. But the risks posed by intentional balloon releases aren't just limited to wildlife. When plastic balloon fragments break down in our oceans, they release climate-damaging gases like methane and ethylene. And they damage plankton, which further interferes with the ocean's ability to absorb carbon dioxide. The vast majority of plastics are derived from fossil fuels, and the breakdown of plastics debris, like intentionally released balloons, is just one more way in which single-use plastics are damaging our climate and harming wildlife and our environment. Banning intentional release of balloons is an important step on the path to protecting our communities here in Rhode Island, our natural environment, and our climate from the hazards of single-use plastics. CLF again supports House Bill 5376. Thank you for the opportunity to testify, and I'd be happy to answer any questions.
Any questions for Mr. Budres by the committee? Seeing none, the next witness is Tophher Hamlet. Tophher?
Yes, sir.
You're on live. You're before the House Judiciary Committee.
Thank you, Chairman Craven. Thank you, members of the committee. My name is Tophher Hamlet. I'm Director of Advocacy with Save the Bay here in support of H5376, which bans balloon releases, and I want to applaud Representative Donovan and her many co-sponsors for introducing the bill. I think this is the third year running, and I appreciate Rep. Donovan's persistence with this very good policy prescription for a real problem. You've heard the representative of the Scouts talk about the impacts of balloons in the marine environment, so I won't go over that again. But I will call your attention to some data that should be provided with your the written testimony we submitted, and that's data from 1 day and 1 year. On May 20th, 2019, an intrepid beachgoer in Little Compton named Jeffrey Dennis collected 282 balloons from beaches along the Sakana River. That's 282 balloons in 1 day. Mr. Dennis also, in a 1 year period, collected 1,103 Mylar balloons from Little Compton beaches as well. So it's a persistent problem. We support the legislation. Save the Bay also feels that the amount of the fine, $500, is appropriate and a good, strong deterrent against folks who do this knowingly. So we Save the Bay strongly supports the legislation, and we thank Representative Donovan and her co-sponsors for introducing it. Thank you.
Thank you. Any questions of the committee of Mr. Hamlet? Seeing none, the last witness on this bill is Rupert Friday from the Rhode Island Land Trust. Rupert? Rupert?
Good evening, Chair Craven, members of the House Judiciary Committee. Thank you for this opportunity to testify on House Bill 5376, and thank you to Representative Donovan for sponsoring this legislation. I'm Rupert Friday. I'm director for the Rhode Island Land Trust Council, which is a coalition of over 45 land trusts across the state. And once land trusts protect the property, they steward this land. And land trusts find that cleaning up Mylar balloons on their land and in the ones that get tangled up high in the trees are a constant stewardship issue. Land trusts that have properties along the ocean, ponds, bays, rivers, find hundreds of balloons washing up on the shorelines. And balloons often make up the greatest volume of litter along their shorelines. For these reasons, the state's land trust community respectfully requests the committee to approve H5376, and I'd be happy to answer any questions.
Any questions for Mr. Rupert? Seeing none, that concludes testimony on House Bill 5376. Thank you, Representative Donovan.
Thank you.
It brings us to the next bill, which it's fairly, oh, I'm sorry, go ahead. Representative Porter's bill, 5388. It's an act related to health and safety. Anatomical gifts. It requires that all applicants for driver's license and registry-issued identification cards automatically become organ donors unless they execute a declination card. The floor is yours.
Thank you, Chairman Craven, members of the committee. I appreciate your time tonight. I know that you have a long agenda, so I'm going to try to be as brief as I possibly can while giving you a comprehensive overview of this issue. This is a bill, 5388, to help improve on our current system of organ donation. We have a growing trend where the amount of people in need of an organ transplant is rising at a quicker pace than the amount of organs that are available for donation. Despite all of our advances in medicine and technology, along with an increased public awareness of the importance of donating organs, the gap between supply and demand continues to widen. Nationally, over 107,000 people are currently on a transplant waiting list, and of that, 93,000 are in need of a kidney specifically. Locally, throughout New England, we have 6,200 people who are on a transplant waiting list, and of those, 4,788 are currently waiting for a kidney. This list does not consider people who need an organ transplant and are not qualified to be listed. People can be often taken off of a transplant list for not meeting certain health requirements, not being compliant with their treatment, or not having available adequate health insurance. Across the country, the average wait time for a kidney is 5 years. And from personal knowledge, I can tell you that the cost billed to Medicare on behalf of a patient who performs their own dialysis at home, which is thought to be the cheaper option, is roughly $35,000 per month. So if we do a little bit of simple math on that, of $35,000 per month over a 60-month period, we come out with an estimated cost of $2.1 million per patient for receiving dialysis treatment. Unfortunately, despite this massive amount of spending, not everyone on a transplant list ends up receiving one, and each year roughly 8,000 people die because they're no longer able to wait any longer for one. Now here in Rhode Island, like most states, the most common way that people enroll to be an organ donor is at the DMV. Over 98% of those enrollments happen at the DMV. And while there's a consensus that around 90% of people would like to be an organ donor, in Rhode Island, unfortunately, we're only registering around 45% of those people. Now, one of the problems with this, one of the challenges here, is that when people go and register to be an organ donor, they need to do that each time they renew their license. So somebody, and I've learned this from personal experience because I first signed up to be an organ donor when I was 16, and then later, throughout my work on this issue, realized I'm not enrolled to be an organ donor. Unless you continue to re-enroll each time at the DMV, you're subject to be taken off of that list. Now, when we're talking about this, it's a very serious issue, and I want to be clear regarding just how serious of a subject it is. It's important to understand the people who are potential organ donor candidates. The only people who would qualify are people who are on a ventilator in a hospital and clinically brain dead. So if you're passing away from old age or natural causes or not in a hospital setting, you're not a viable candidate to be an organ donor. It's a very small percentage of people. It comes out to roughly 3 out of every 1,000 people who pass away. Now, how the process goes in trying to make up for this gap is by having a nonprofit organization called an Organ Procurement Organization, or an OPO, who are the regional organizations that are contracted to facilitate donations. They will approach the next of kin, and if the potential donor was somebody who isn't registered to be an organ donor and hasn't given their consent, they'll ask them to. It's also my understanding that they do confer with the people who are actively enrolled to be an organ donor too. They confer with their families and get their consent before moving forward. Now, one of the biggest challenges here that I want to highlight is that it's estimated between 20 and 40% of all organ donations that don't happen when there is a potential donor available. It's due to not being able to contact somebody with the authority to give the consent on behalf of their loved one. So what this bill would seek to do is when someone is at the DMV renewing their license or getting a new ID, the applicant would be notified that if they wish to not be an organ donor, they need to decline it. They select that option and then they're registered as such. Now, objectively, I want to lay out for you what the opposition to this is. Most of it is based on personal bodily autonomy rights, to which I would argue that a policy like this is actually more in line with that principle, where we would then have people knowing they needed to make that decision for themselves rather than leaving it to a loved one to make that decision when they're no longer able to. Part of the opposition is also based on a belief that we have certain cultural values in America where if people think they're being forced into doing something, they're going to rebel against it, and you're going to end up with less donors because of that. One study I was provided to suggest this estimated that between 25 and 36% of people would opt out, and nationally, we have around a 70% authorization rate when you add up all of the people who have registered, as well as the people who the NPO, the OPO has obtained consent from a family member. So if these figures are correct, you could theoretically end up with a decrease of 4%. But I would suggest that this data is nothing to really hang our hat on. There's a number of other studies that suggest the complete opposite of this. One study from 2017 by researchers at the University of Pennsylvania calculated that a better functioning system to secure deceased donors would produce up to 28,000 more organs per year. And to give you some context, last year we had a total of 39,000 transplants done. So a system like this is in place in a number of other countries, and a global study by multiple universities in the United Kingdom monitored 48 countries over a 13-year period, where they compared 23 countries using an opt-in system similar to this against 25 using an opt-out system, and found that the opt-out systems had a higher total number of transplants. Now, I'm not suggesting that any of this data is overwhelmingly compelling and conclusive one way or the other. What I am suggesting is that there's an obvious flaw in our system and there's a lot of room for improvement. And the upside, with respect to the potential this has if it works, far outweighs the potential downside when so much of the theory is just so highly speculative. We're not going to know for certain until a process like this is actually put into practice, and then we can monitor the results. But given Rhode Island's size, given our population, this is an opportunity for our state to lead on something really important, to try to see if this benefits the system, to see if this is effective in lowering wait times on transplant lists, if it's effective to reducing the healthcare cost, and ultimately saving people's lives. This would normalize organ donation, and I want to stress that the consent is in line with the public sentiment. So with that, I'm open to working with the committee on the issue. I know it's the beginning of a conversation. The ACLU has expressed some valid concerns regarding language barriers and respecting people's religious rights, and that's certainly nothing that we want to infringe on. So again, I'm very open to interpretation and your input on it, and I thank the committee for your time, and I'm open to taking any questions.
Yes. Yes, you may. Dr. Kovesi.
Thank you, Mr. Chairman. Representative Potter, I understand the altruistic intentions behind this bill. Let me just say that those intentions aside, and whatever surveys or polls that may be taking about the sentiment of organ donating, I'm very much opposed to this bill on two matters of principle, which under similar circumstances with other similar bills, I'd be against. I don't believe in automatic enrollment for anything, and I certainly don't believe in an opting out as opposed to an opting in. With all due respect, I question whether the general populace, being in their busy lives when they're doing things such as applying for their license, would have the presence of mind to opt out, regardless of how they're notified. So I think the bill is inherently flawed on both, in both cases. Automatic enrollment, which I do not believe, because you can change your mind. And number two, with an opting out provision. Opting in is one thing. Opting out is another. You cannot lock people in. And whether it's a well-intentioned bill like this or any bill that would have an automatic enrollment or a opt-out position, I would be vehemently opposed, respectfully.
Representative Place. I'll be right with you, Tom.
So, Representative Potter, the question I have is, I have a particular disqualification for being an organ donor. It's something that only I know, that I found out because I was on a list once and I came up as a potential candidate. And again, as the questionnaire went through, I cannot donate organs. I personally am not going to see, with all the things, when you sit down those little booths at DMV to fill out your license, I'm not going to see that one. So how do you prevent, and I do have a follow-on statement as well, Mr. Chairman, so I'm going to ask the question first and have a follow-on statement. How do you prevent someone like me winding up in the pool because it's mandatory, how do you weed that out?
Yeah, that's a great question, Representative. I think we're going to have some testimony on this that could address it from medical professionals. But I imagine that when a potential donor is in that state, their medical history would be available.
Only I know this. It's not my medical records. I have a particular situation that I experienced when I was younger that I only know based on memory because of the question they asked. And I'll honestly share it with you afterwards if you'd like to,
sure.
to show what it is. But again, there's some things that preclude people from donating that are not in your medical records, that only you know because of your experiences and what you've gone through and what you've done in the past.
From my understanding, and of course I do not have any professional medical experience, but from what I gathered from talking to the experts in the field, there is a very high barometer of inspecting a potential organ donor, and they are very disincentivized to taking an organ from somebody where there could be any risk of the new recipient rejecting that. So without knowing what the personal issue that you're referring to is, I think, defer to thinking that it probably would come up in some of the framework and the screening that they do.
It would not unless I'm conscious. They can ask me, and if I'm in that condition, I'm not probably a qualified organ donor for the situation you're dealing with. My comment is, my understanding from your testimony was the reason why you brought this before us is because in your experience, you had volunteered to be an organ donor and it dropped off your license. Is that correct?
Actually, no. I started working on this legislation earlier, and then throughout really researching it, came to realize that I'm not active.
But you had at one point in time and it had dropped off.
Yes.
So why is it a compromise between what Doc's talking about? Why not, instead of compelling people to do this without their permission, if someone has already signed on, why can't we just ask the DMV to continue? For whatever reason, there's something, it's a computer, well, God knows the state isn't good with fixing computers, but it's something within the computer. All they have to do is make it mandatory that if you sign up at 16, that it continually goes on there until you opt out. So that way we're not requiring anybody to go on. We're not making it mandatory and not letting people necessarily know. Because again, I see where you're coming with the disclaimer, but you're just not going to see it. But again, if once you sign up and you make the conscious decision, the DMV just shouldn't allow it to come off. So that's the fault of the system. The fault in the system is that we don't make everybody do it. The fault is, for some reason, DMV drops it off and never gives you the opportunity to go back on, or never without you physically doing it from there. So my recommendation, because again, I do have to agree with Doc on this, is that, you make it mandatory, you make it like this. There's so many civil liberties implications in this. But again, if you'll just allow, once you make the decision, have DMV, just don't allow it to drop off unless you then opt out. I think that it goes a long way to solving the problem that you're trying to address.
Well, I agree, and I want to be brief too. I'm mindful of the committee's time. I think that's one component that needs fixing. I think that's a very simple fix, to agree with you, where that shouldn't be a controversial subject. If somebody opts in, they should be registered as such, right? It's not the main issue with this. The main issue with this, I really can't completely diagnose as to one thing, but I would say that when you have 3 figures, 98% of all registrations of enrollment are happening at the DMV. Public sentiment, 90% of people want to be an organ donor, only 45% are enrolling. There's a glaring flaw based on those figures that I'm open to collectively hearing how we address it. I think that's one part of it. I think part of it is raising more awareness to organ donation, and to Chairman Corvasi's point too, when you're at the DMV, I know the few times I've been there, the last thing on my mind is, let me make sure that I opt in to be an organ donor, right? I mean, there's a whole lot of stuff going on, and people are typically pretty encouraged to get out of there as quickly as they can. So there's a lot of work that we can do on this. I'm open to that point, but I would say that it does not solve the overwhelming issue itself.
You realize, Representative Potter, you've done a very difficult thing. You've placed Chairman Corvasi and the ACLU on the same side of an issue.
Representative Norrie.
Thank you, Chairman. I'm going to echo Representative Corvasi's statements, and again, with all respect for this issue, 23, so line 31, 2318 .6-2.6, Oregon, the presumption. So I have a problem with the end of the bill. So a Rhode Island driver's license is issued for 5 years. Anybody that has received a driver's license in 2020 and 2021 will be, by this provision, says that any person possessing a motor vehicle operator or chauffeur's license or division of motor vehicle identification card shall be deemed to have consented to be an organ donor unless they've completed or submitted an organ decline card. So that's saying that anybody right now that has a license for the next 5 years is automatically opted into this program with not ever given the option to opt out. So again, as Rep. Corvese said, you know, we're forcing people into a program that we're never giving an opportunity to even opt out over the next 4 years.
Yeah,
So
that certainly was not the intention of the bill, and I'll have to go back and look at the language of it. For the record, it was the first bill that I had drafted from Legislative Council, and I know it's a pretty lengthy bill, so I'm certainly open to amending it. That is not the intention of the bill. There's specific language in there to really stress upon making it a point that people are aware of the process. We do not want to deceive anybody. We don't want anyone to be tricked by this legislation. Again, we want to get our enrollment numbers more in unison with what the public sentiment is.
Representative Corwell.
Thank you.
Thank you, Chairman.
If I may.
Go ahead.
Okay. Thank you, Representative Potter. I recently renewed my license, and when I went to get it renewed, I did not feel overwhelmed by the paperwork or that I would not be able to make this decision or answer this question. I had like one piece of paper with my registration and my insurance policy number on it, and like my insurance or my car registration or my bank, whatever. And, you know, I think an opt-out we do for so many things now. If we do it online, it's a checkbox, and we can sit at our computers and think about it and decide if we want to do it or not. That doesn't seem burdensome to me, especially when the good outweighs the other options. So I would have to disagree with some of my colleagues. I think that it's a good idea, and it's a good first bill to have drafted. So thank you.
Any further questions of committee members of the sponsor?
I have a question, Mr. Chairman.
Yes.
Rep. Felix.
Yep, please proceed.
Hi, Representative Potter. I have a quick question. Has any jurisdiction done this? Is this modeled from other states?
Yeah, thank you, Representative Felix, for that question. That's an important point. Recently, Nova Scotia was the first North American jurisdiction to put this into practice. This law is not in play in any other state. However, similar legislation has been introduced and is being worked on a number of other states: Massachusetts, Connecticut, New York, Vermont, California. There's a number of states introducing it.
Representative Batista, you had a question.
More so of a comment. I just wanted to share my personal perspective, especially thinking about my constituents and my community here in South Providence. And I appreciate Representative Potter and his bill and this idea. To the extent that there are ways to make the bill better, I know that Representative Potter will be working with folks to incorporate those ideas. But I just wanted to give a little bit of specific and personal reason for why I think this is a good idea, or at least the general policy perspective of trying to increase organ donorship. I know, for example, Representative Diaz has been very passionate about creating more awareness for diabetes in South Providence, which is somewhere that we suffer disproportionately of. And I personally have had very close family members who've suffered diseases and illnesses like diabetes who find themselves in need of an organ. Sadly, my father's in that position right now. And we are hopeful that things will work out. And obviously my family is one family. But I imagine that there are thousands of Rhode Islanders in the same space. And so I can appreciate the concerns brought up by the representatives, by the ACLU, by some organizations. But when I think about this idea, I think about how personally it hits home and how many family members and constituents and folks that I know that have been on that waiting list and know the pit in their stomach of hoping to get that phone call and the consequences of what happens when that phone call doesn't come. So I appreciate you for this effort. I'm sure you didn't know that someone like me would directly benefit, or a family like mine would directly benefit from this effort. But I look forward to working with you and improving this bill to see ultimately that policy goal reached. And I appreciate you for your efforts, Representative.
Thank you, Representative Batista.
Thank you. Any further questions of the members of the committee? Yes, Carol.
Thank you, Representative Potter. So the only thing you're asking is opt out. If you don't want the to donate your organs, you have to opt out, right? That's exactly what you're saying here, right?
Yeah.
As opposed to opt in. I mean, I always opt in, and I'm surprised that the numbers are so low. And I think with science moving the way it is, that more and more will be relying on organ donation in the future. And I think I commend you for bringing the bill. The other place where we have to opt out is at the registry, is if you don't want to vote, you have to opt out. So I believe that's how it goes at this point. Everybody registers to vote when you sign up for your license. And if you don't want to vote, you have to opt out. So, you know, there may be something to what you're saying here. And I appreciate it, because we do need more people to donate their organs, because what are we going to do with them, right? And somebody else can benefit. So very good motivation, but thank you.
Thank you.
Representative Norrie, all set? Okay, we can go to the callers now if there are no other committee members. David William Hutton. Mr. Hutton?
Yes.
You're on the air.
Great. Hi, my name is David Hutton. I'm an associate professor at the University of Michigan School of Public Health, and I study public health policy. I just want to say here, related to Bill 5388, there's a great imbalance of supply and demand for organs. There are about 2 transplants for every 3 new people added to the waiting list. In 2018, about almost 4,000 candidates died on the waiting list. I believe Bill 5388 is a modest proposal that may help address this important public health problem. I've been studying the economic and public health impact of organ transplantation policies for almost 10 years, and I believe some of my colleagues will be joining here in a few minutes too. One potential way to alleviate some of that imbalance between supply and demand would be to default to individuals being organ donors unless they decline, which I'll refer to as presumed consent. One of the best studies of this, of the impact of presumed consent, is a systematic review by Rathalia et al. In 2009, published in the British Medical Journal. This review included 8 studies comparing European and OECD countries, high-income countries, with presumed consent to those without. And it also looked at 5 studies comparing kind of the effect before and after introducing a presumed consent system in 3 countries of Austria, Belgium, and Singapore. Their review suggested that instituting a presumed consent policy was associated with an increase in organ donations in the range of about 20 to 30%. Now that's a relatively big increase. It's unclear if we'd see that same kind of increase in the United States. But our research group has looked at the impact of that type of an increase on the health and economic outcomes, and we estimate that even a modest 5% increase in kidney transplants alone could lead to about $4 billion in savings across the United States, just looking at the impact of people currently waiting on the kidney transplant list, and could lead to the equivalent of almost 30,000 years of life gained in kind of perfect health. So I believe this bill is a low-risk, low-cost way to try to increase the supply of organs. The bill could not only help the people of Rhode Island on the transplant waiting list, but could also provide information to other states so they could better understand the potential impact of this kind of a change like this. And that's all I have to say.
Thank you very much, David. If there are no questions of Mr. Hutton, Alex Albright is the next witness. Mr. Albright? Dr. Albright? If you can hear me, you might not have your mute button.
Yeah, this is Dr. Parikh, is that right?
Yes, okay.
Yes. Yeah, hi, I'm Dr. Parikh. I'm an assistant professor of transplant hepatology at the University of Michigan in Ann Arbor. I work with Dr. Hutton. I've enjoyed listening to the discussion online. I think some excellent points have been brought up. You know, I'm a practicing liver physician. I take care of patients prior to and after liver transplantation. I'm also part of the research group that Dr. Hutton mentioned, and we've been studying organ allocation practices and ways to increase organ donation in the U.S. For the last decade or so. And, he mentioned some of the work that we've done in the past. I'm also on the kind of boots on the ground. I'm a practicing transplant physician, and I understand how organ allocation works. So I think it's important. I think some of the points that were brought up earlier in the discussion, it's important to understand kind of the process of organ allocation. So, when somebody is deemed an organ donor, when somebody passes away, the Organ Procurement Organization, and there's one in New England that is responsible for retrieving those organs. And these are federally funded nonprofits. There are 58 throughout the country, and they act to basically, or they're responsible for procuring organs and kind of coordinating with the transplant centers in order to get the organs into patients. When a patient is deemed an organ donor, the OPO sees if they're medically reasonable. They have representatives at these hospitals, sees if they're a medically reasonable candidate, if there's any contraindication clearly, and then they run them by the organ transplant centers. And the organ transplant centers do an additional screen of these patients or these potential donors to see if they're viable, if there's any major contraindications, and they figure out which organs are available for donation based upon the patient's comorbidities and other medical conditions. And you can donate things like livers, hearts, lungs, kidneys, and things like cornea. They do skin, things like that, pancreas. All these sorts of organs can be donated. So it's not so just because a person has a medical condition that may preclude kidney donation, for example, they may be a viable heart or a liver donor. And then they do blood testing and things like that to make sure that there's no infections or anything. The authorization that we're talking about here with presumed consent, being on the organ donor list, is a kind of a way for somebody to say what their intention is for organ transplantation. There are a proportion of patients that so when a patient is an organ donor, they're usually incapacitated, and their next of kin is typically contacted to say, okay, they're a potential organ donor. Is there any, are you okay with this? And that practice varies among OPOs, whether they to what extent they discuss this with the next of kin. But there is a process where the next of kin say, no, I don't want that to happen. There are patients that are potential organ donors that the next of kin cannot be contacted. We don't know exactly how many patients that is, but that is probably where the yield can be greatest with an opt-out sort of policy that we talk about, that we're talking about here. And so, this policy would basically be for patients who, we can't get the next of kin, we can't, or they seem like they're a medically suitable donor, but, there's nobody to provide consent. But we do know from national surveys that the vast majority of people would be an organ donor if asked. But there's a disconnect between organ donor registration and intention. So this bill would move to remove that barrier, but it would also provide a kind of a natural experiment in the U.S. For this sort of policy. As Dr. Hutton already mentioned, this sort of policy has been instituted in many other countries worldwide, including many European countries and some provinces in Canada. So this is not kind of new to the Western world, but it would be new to the U.S. And so I'd be happy to take any questions.
Any questions for the doctor? Thank you. Next witness is Alex Albright. Alex Albright, are you on the air?
Hello, this is Alex.
Yes, proceed. You're on the air.
Good evening, ladies and gentlemen. My name is Alex Albright, and I'm a medical student at the Warren Alpert Medical School at Brown University. I am here to testify in support of Bill number 5388. Thousands of people every year are put on a wait list hoping that their name will be called with an offering to renew their lease on life. Every year, thousands of people wait patiently for their turn to receive a new kidney, a new liver, or a new set of lungs that can dramatically better their lives forever. organ transplantation is one of the very few operations or medications that has the ability to immediately cure someone of a disease. However, it is also one of the very few operations or medicines that has the ability to save our government money while simultaneously saving lives. The only limitation is the number of organs available for this life-saving operation. Bill 5388 will effectively increase the supply of organs available for transplantation while immediately slashing the amount of money the state spends on Medicare. Kidney failure affects almost 750,000 people per year in the United States, and about 100,000 of those people are placed on a wait list for a kidney transplant. According to the National Institutes of Health, the need for kidney donors is rising 8% per year, yet the availability of organ donation fails to pace that rate. So, what happens while people wait? People receive dialysis to compensate for their failing kidneys. A typical dialysis schedule requires a patient attend 3 dialysis sessions per week for 3 to 5 hours per session. While not even taking into consideration the financial and psychological burden sustained, if you were all forced to spend 15 hours a week on dialysis, what would you be forced to sacrifice that week? Would it be 15 hours of sleep, 15 hours of work, or 15 hours with your family? Financially, the annual cost of dialysis is $90,000 per patient per year. Yes, these patients are covered by Medicare, but that money comes from your budget. The 750,000 people who live with kidney failure makes up to 1% of the U.S. Medicare population. However, that same population is 7% of the budget. In aggregate, this amounts to $28 billion annually. In comparison, the annual cost of an organ transplant and subsequent therapy is only $16,000 a year, with the aggregate amounting to $3.4 billion. That's nearly a 90% decrease in price. Now, here's the hard part to quantify financially. Let's consider the 15 hours a week these people miss from work. That's 780 hours of work each patient on dialysis misses per year. If we assume a $10 hourly wage, that's another $7,800 annually these people are missing out on. Now, try to financially quantify the psychological burden these patients bear every year, every single day. How about the psychological burden their family members and loved ones also bear? How should we quantify the suffering that accompanies waiting years for something that may never come? Right now, we have the opportunity to immediately increase the supply of kidneys and other organs available for transplantation.
Thank you.
We're not only saving lives and a lot of money, but we're also sparing thousands of people every year of the psychological suffering that could never be quantified. Thank you for your time.
Thank you. Next witness is Luke James DeRose. Luke, are you on the air?
Yes, I am.
You can proceed.
Thank you. I'm a healthcare engineer here to testify in support of this bill. I'd like to echo the comments of many of those who've testified before me who discussed sort of the urgency of the organ donation shortage, and then furthermore to echo the data that suggests that other countries or provinces that have implemented a presumed consent policy have seen increases from 20 to 30% in organ donation. Recently, a fear of public backlash to an opt-out policy around bodily autonomy was an obstacle in recently implementing countries like Wales, but evidence suggests that this backlash has not yet arrived. And even conservative estimates, data-driven models translate this increase in organ donation to a gain of anywhere from 4,000 to 50,000 life years gained for patients awaiting transplant. And this is a major impact on patients in critical condition experiencing organ failure. Overall, I just wanted to echo that the data suggests that presumed consent donation could be an immediate way to increase organ donation rates and improve transplant outcomes. I thank the committee for hearing this bill, and I'm happy to take any questions.
Thank you. Next witness is Marelle Sophie Lavery Williams from the University of Michigan. Hello, Can you hear me?
Yes.
You're on the air with the House Judiciary Committee in Rhode Island.
Can you hear me?
I can. You can proceed. Go ahead and testify.
All right. Good evening, Mr. Chairman and members of the committee. My name is Mariela Vieri, and I'm an associate professor at the Industrial and Operations Engineering Department at the University of Michigan, and I'm here to testify in support of Bill 5388. I would like to echo what my previous professors have mentioned. I specialize in the methodological aspects of this work, and our team has performed quite a bit of research in understanding what would be potential impact on the potential different scenarios of what this bill could bring. And it's substantial, the changes that a bill like this one could have. Again, my expertise is mostly on the methodological side of things, so on queue and theory and understanding how wait times for organs could be impacted by such a bill. And indeed, even a very small change that this bill makes could have saved many, many lives. So hence, I'm really in support of this bill. Thank you for your time.
Thank you very much. The next witness is Alexandra Glazer. Alexandra?
Hence, I'm really in support of this bill. Thank you for your time. Very much.
Alexandra?
Yes, hi. Thank you for this opportunity to testify tonight. I'm the CEO of New England Donor Services. I'm also an attorney and a public health policy expert. New England Donor Services is the OPO, and this has been organization mentioned previously in other testimony. We're the nonprofit designated by the federal government to coordinate organ donation for transplant in New England, including Rhode Island. And our mission is to save and heal lives through donation and transplantation. We work with every hospital in the region. That's about 200 hospitals. Our staff are 24/7, 365, frontline, even in the middle of a pandemic. We screen potential organ donors. We check the donor registry to see if an individual has made their own decision. We work with families if the individual is not registered to obtain consent, or to ask for consent if the individual is not registered. And we coordinate all of the surgical logistics and including allocation of organs to transplant recipients. Donation and transplant touches many, and I note comments even on the last bill regarding someone who received a double lung transplant, which is fantastic to hear, and it's really why our organization does its work. We would be the one that coordinated that. So like everyone else at this hearing, New England Donor Services fully supports the policy goal and the intent behind House Bill 5388, which is to increase donation and serve the patients waiting. But we do oppose this bill because we think that there would be negative unintended consequences that could actually decrease organ donation in Rhode Island and here in our region where we have a regionalized system. And it's important for the committee to understand one piece that hasn't been brought up yet tonight, that the legal framework for organ donation is governed by the Uniform Anatomical Gift Act. And this is a uniform law to ensure that there is legal consistency state to state on how organ donation can be accomplished. So organizations like mine, New England Donor Services, can have certainty in the critically short periods of time that we have to coordinate organ donation. Every state, including Rhode Island, passed the UAGA since 1968. So the UAGA creates an opt-in system. And as you all have already heard, you can do this when you renew your license. You can opt in online through a national registry. You can do it on your iPhone, through the health app. But the important point for the committee tonight is that all of these processes require an action to legally authorize that gift. So over the past 10 years, there's been a lot of success nationally and locally with our opt-in system. The U.S. has 150 million registered donors nationwide and over 500,000 in Rhode Island. We've already heard that that's about 50% of the adult population. So our system also has another opportunity for our organization to get to a yes, which is to approach families if an individual has not registered and there's a medical opportunity for organ donations. We have those two pathways to a yes, and combined, that gets us to about a 70% overall authorization rate. I want to mention, because a couple people have already talked about this, about year-over-year opportunity for growth. The current system is actually growing at 6% per year since 2013. So the 5% increase mentioned previously in some testimony is actually lower than what we're already accomplishing in our current opt-in system. This puts the U.S. as one of the highest rates of donation in the world. We outperform all other countries in the world other than Spain. The rate in the U.S. is twice that of the countries in Europe other than Spain. So we're still not meeting the need, and the urgency is real, and all of the testimony we've heard so far I think is incredibly compelling on why this is a very important topic, and our opportunity to do better remains sort of the forefront of what we should be thinking about. So will this actually increase donation? No. The data show that overall the U.S. and countries with opt-out actually outperform jurisdictions with opt-in with a 27% higher donation rate. And there are many countries that have switched from opt-in to opt-out that have shown increases, but none of them have started anywhere near the rate of donation that we're already achieving at the U.S. They've been countries that had very low donation rates to begin with, so it's an effective strategy there. There are no examples of a country performing even close to the level of the U.S. achieving benefit by switching. And there are examples of countries seeing decreases, for example, Brazil. One of the other reasons that's been mentioned for going to an opt-out is to bridge the gap between sort of the intent people, the public say they would want to donate, and the action of actually taking the steps to register. But as I've mentioned, actually, we have the ability to do that because we can approach families for permission if an individual did not register, and the family would presumably know that this would be what the patient wanted. I've also heard in the testimony a couple times that there's an issue with no family being available to approach for donation. I don't know where that information is coming from. I can tell you in our experience here in New England that pretty much never happens. In the past 10 years, I can't think of more than 1 or 2 cases where we've been unable to find a decision maker. So I think that that's a piece of misinformation. So the last thing I would just say is the signaling effect and normalization of donation. You know, we're not starting from scratch, and so we really have to be mindful of whether something like this would actually decrease where we're at, which is 70%. So the question is, would potentially more than 30% opt out, or even close to that, because we're growing at 6% a year. So I think the culture here is really well aligned with opt-in donation policies. Americans, those in Rhode Island, they simply don't want the government presuming that they can take their organs without asking. I mean, I think we're a culture that's founded on these autonomy principles. We prioritize individual rights, and that's really well aligned with opt-in policy. I think we can take a look at what happened when the government suggests people wear masks for their own benefit as well as for the benefit of others, and think about how well that played out. There are also a number of legal issues. As I mentioned, the UAGA is a gift law standard. I don't think that the process described in the bill would meet the anatomical gift law requirements under the UAGA, and I also think it could be subject to a constitutional challenge. And all of this really just jeopardizes our ability to rely on registration at the time of the donation must be coordinated, which could be middle of the night, weekend, and we have literally hours to get that done, so it's critically important. I would pivot and say there are some great ideas, and one of them was already mentioned by a representative early on in the testimony. Yes, carryover is the concept of once someone's registered, why are we asking them to re-register every renewal? Instead, you know, we should encourage lifelong registration by asking once, and then an individual remains registered unless they take a step to take themselves off the registry. So we would support a movement in Rhode Island to that. Other states have done that successfully. Also, I'd mention another idea is to have a $1 checkoff registration to fund a public campaign to help continue to support the growth we're seeing in organ donation. There's a council that already exists established under Rhode Island law that could effectively manage that. And with that, I'm happy to take questions as the organization responsible for coordinating organ donation here in Rhode Island.
Is there any questions from Ms. Glazer? Seeing none.
I have a quick question.
Oh, okay. I'm sorry. Go ahead.
No worries.
Representative Felix, go ahead.
You mentioned in terms of Spain having a better system. Do they have an opt-out?
So Spain has a system that is considered opt-out. However, they allow families to stop the gift. So in other words, they allow family objection to stop the donation, which then in effect removes the legal default. It's no different than asking the families for permission. When you talk to the Spain authorities, which I've done, the leadership of organ donation and transplant in Spain, they attribute their rates and their success to systems within the hospital and cultural differences and not the legal default. I'd also say that actually in 2020, U.S. attains the same rate as Spain. So while I don't want to say we're better than Spain, we're attaining the same rate of donation per 10,000 deaths that Spain is achieving as of this past year.
Thank you.
Thank you.
The next witness is George David Fleming. Mr. Fleming, you're on the air with the House Judiciary Committee in Rhode Island. Next witness is George David Fleming.
Good evening, Mr. Chairman. Can you hear me okay?
I can.
Great. Thank you so much. My name is David Fleming, and I am the President and CEO of Donate Life America. I just want to give you a little background so that you can understand why I'm speaking here today. Donate Life America is the national nonprofit that focuses on increasing organ, eye, and tissue donation in the United States. We are a national membership organization. Our membership includes members from the United Network for Organ Sharing, the Eye Bank Association of America, the American Association of Tissue Banks, the Association of Organ Procurement Organizations, the National Kidney Foundation, and others. It also includes representation from most medical societies involved in donation and transplantation, including the Association of Transplant Surgeons. We are an innovative and forward-thinking organization. In 2006, Donate Life America launched a national initiative to establish effective opt-in donor registries in every state in the United States. When we started this process in 2006, we had 40 million Americans registered as organ, eye, and tissue donors. Now, proud to say, and I can update a number that you heard from Ms. Glazer, we have now achieved registering over 165 million Americans in the United States, and that represents 65% of adults, those over the age of 18, have made a legal authorization, which is in step with the Uniform Anatomical Gift Act that Ms. Glazer mentioned earlier. Also, just to the point of innovation and the fact that we are always looking to do everything that we can, in 2016, we launched a national online registry, which allows individuals, no matter what state you live in, to register nationally on our registry. We did that in partnership with Apple and iPhone, also integrating with every Apple iPhone user has the ability to register through their iOS system and their health app. That is then fed into our national registry. That national registry, in addition to our incredible state registry partners, is available to all the organ recovery organizations in the United States. That registry in and of itself has registered over 7 million Americans in the last 5 years. And all of this has helped lead to the significant increases in the number of transplants that are being performed in your area and other areas around the country, as Ms. Glazer said, which is pacing at about a 6% increase every year. And I would like to, the reason I keep using this word innovation, because I would like to commend the author of this bill for thinking aggressively about how we can address what I refer to as a national health crisis with all of the patients that are waiting for transplants. And our organization certainly is in this aggressive state of mind, which is why we have taken the steps that we have. Like many of you, 10 years ago, when I heard about opt-out and this opportunity that we might have to encourage more people to register through the system of opt-out, I was very intrigued. So I went on a long, extensive research pathway, speaking to many of the countries that have been mentioned, my peers in those countries. And if I thought this was a more positive pathway, I would be there in person, trying to help you make the decision to do this. Unfortunately, my research, as we have unpeeled this onion the way it would really operate in the United States, I have come to the firm belief that opt-out would likely result in fewer registrations and fewer transplants in the United States. And we've heard a lot of statistics. I will give you one that hasn't been mentioned. So we do a tremendous amount of consumer research with the American public so that we can determine how Americans are thinking, acting, and feeling towards organ, eye, and tissue donation. That research routinely identifies that the #1 myth in the United States, the #1 concern that people have about registering to be an organ, eye, and tissue donor is the concept that medical professionals may not try as hard to save their lives if they know they are a registered donor or they know they are a donor. And then furthermore, of likely donors, people that support the concept of organ, eye, and tissue donation, 25% of them say the reason they have not registered, though they are supportive of organ, eye, and tissue donation, is because they don't want that little heart on their driver's license for fear that they will get inadequate care. So we have about 28% of the American public says they're concerned about this. We have 25% of people who support donation saying they will not register their decision to be a donor and they would rather leave that decision to their families after they die. Our concern is, as in this opt-out system as it has currently been proposed, you have two choices at the DMV when you get your driver's license or you renew it. You have the choice to opt out, which is to say I do not wish to be a donor, and that is a legal opt-out, which means you now cannot be a donor. Or you have the ability to do nothing, in which case you are registered and that little heart shows up on your driver's license. So we have accidentally disenfranchised the 25% of people that don't want it on their driver's license and would rather leave that decision to their family. And unfortunately, I think the way our culture operates based on our research and forcing the hand of that individual that has that concern, we may be accidentally pushing someone to opt out, which now is prohibiting the ability to get consent from their family, even though they support donation and transplantation. I would also like to echo Mrs. Glazer's concerns around the Uniform Anatomical Gift Act. Gift law requires an affirmative action, and the only time this really matters is in the case of conflict. So you have a registered donor or someone that the medical staff believes would like to be a donor, and you have a family that is in the worst moment of their life, having just lost a father, a husband, a neighbor, a loved one, and they're being asked to give consent. So we find ourselves in the situation of often organizations like New England Donor Services find themselves in front of a judge, and the judge typically asks a pretty simple question. Prove to me that this person wanted to be an organ, eye, and tissue donor so that I can make sure their wishes are being honored. The solution to that in an opt-out system is a document of gift, this affirmative action that is a legally binding document. It's presented to the judge, and the judge says, thank you very much. We are going to move forward with the recovery so that we can save lives through donation and transplantation. An opt-out system, when the judge asks for the documentation for how do you know this person wants to be a donor, the only answer is going to be because they did nothing when they went to the DMV. There is no legal document of gift that could be presented at that time. I also have a number of concerns around English as a second language individuals not really understanding what's happening. I think you may hear testimony about that. There's a very popular video done by a behavioral economist from Duke named Dan Ariely that talks about our ability to trick people's cognitive abilities when it comes to advertising and marketing. He uses organ donation and opt-out as one of the examples of how we can trick people's cognitive reasoning, and by doing nothing, they end up registering to be a donor. So I don't think with a subject that is serious as this, we want to find ourselves in a situation, albeit for good intentions and being aggressive and being innovative, to accidentally be tricking people into doing something because they have taken no step. I just would like to add that, you've heard other emotional testimony about this. I've been working in this industry for 8 years before my mother was diagnosed with a rare liver disease, which determined that she needed a liver transplant to save her life. Unfortunately, she was too sick to get that transplant because doctors were not willing to risk a good liver on someone that was that sick. So in 2006, I reaffirmed my commitment to this cause, which is why we have been as aggressive as we have. So I understand from a personal experience what it is like to lose a loved one because an organ was not available. And as I said, I would be the first person there banging on your desk, begging you to do this if I thought it would make a difference. Unfortunately, I would have to speak strongly in opposition for the reasons I have mentioned, and I would be happy to make myself available to the committee for any further consultation going forward as you try and determine ways that you can help. I would echo the yes carryover, I think is a fantastic idea. I would also say that if every person that died could be an organ donor, we still would not be able to solve the kidney challenge we have in this country. So I would encourage the committee to look at some things that could be done around personal leave for living donors, making sure patients have the ability to take time off from work and be reimbursed for that time lost to help increase living kidney donation, which would be a huge solution for the kidney challenges that you have heard very eloquently described. Thank you very much.
Thank you, David. I don't see any questions. The next witness is Katie Richard. Hello, Katie?
Yeah.
Katie, you're on the air. Several people have testified in support, as you are. If you've heard the testimony, could you just confine your testimony to anything additional that you feel as though the committee should know?
Yeah, I'll keep my testimony brief. Thank you, Mr. Chairman and members of the committee. My name is Katie Richard, and I live in Cranston, Rhode Island. I'm a 32-year-old kidney dialysis patient, and I'm testifying in support of this bill. While I cannot speak to every experience with organ transplant, I can speak to my experience regarding kidney transplant and why passing this opt-out legislation would be life-changing not only for myself, but for many people like me. I started dialysis back in September of 2017 due to a genetic kidney disease called FSGS. While I'm on the kidney transplant list currently, the average wait time for a kidney transplant in Rhode Island is approximately 5 years. Sadly, about 70% of dialysis patients pass away after 3 years on dialysis while waiting for their kidney transplant. It's not lost on me that I'm one of the lucky ones. The easiest way to decrease the wait time for a kidney transplant is to increase the amount of organ donors. According to Donate Life America, 95% of U.S. adults support organ donation, and only 54% are registered organ donors. This indicates that the current process isn't working. By streamlining the donation process with this bill, we'll make it easier for people to donate and will help eliminate the red tape that currently exists in the organ donation process. It's easy when we're talking about these figures to forget that each number represents an actual person who is suffering. We have the power to enact something that will give people valuable years of their lives back. One organ donor has the potential to save up to 8 lives. A staggering 3,500 eligible kidneys are thrown away every single year. That's 3,500 people left suffering when they didn't have to, and 3,500 anatomical gifts of life wasted. I urge you to vote for this legislation to allow myself and everyone else still waiting for an organ to feel hope and have confidence that we have a system that's working the way that it was intended to. Last year, similar legislation was enacted in England, and recently similar legislation passed in Nova Scotia. Just by rearranging a few words on a piece of paper will save lives, and Rhode Island can be the first state in the United States to enact this powerful legislation. Thank you.
Thank you, Katie. Very compelling. Any questions of Katie? Thank you. The last witness is Maranatha Tophher. Hello.
Hello.
Hi. This is Bob Craven. I'm chairman of the House Judiciary Committee, and you're on the air.
Thank you so much. Good evening to the members of the House. My name is Maranatha Tophher. I am a first-year medical student at Brown University. As a future physician, one thing already apparent to me is that organ transplants are a significant need in our community. In my clinical training experiences, I've seen many patients who need transplants now or who will need one at some point in their lives. One such patient I will always remember was a relatively young individual who came into the emergency department. Why I will always remember this patient is because at this point in my career, I had never seen someone in so much pain. The hardest part was that even though we knew with great precision the science behind why their organ was failing, there was no way of us knowing, even roughly, if or when their pain would end. I'm here today in support of Bill 5388 because I think the current organ donation system deeply needs reform. We must do better, make organ transplants more accessible for the patients of Rhode Island through an opt-out system. I support an opt-out system for Rhode Island because it also aligns with the biomedical ethical principles that we are taught at the onset of our medical education as the foundation of our profession. These core principles are respect for persons, autonomy, beneficence, non-maleficence, and justice. Respect for autonomy means that individuals can choose. An opt-out system may change the default, but it still preserves individual choice, so anyone with convictions against organ donation is not required to participate. Non-maleficence and beneficence mean to do no harm, to do good, to do more benefit than harm, to do what is best, to do not just what is immediately good, but also the long-term good and the community good. Looking abroad to other countries' experiences following implementation of an opt-out system shows that there is great potential to save lives and do good through this legislation. For example, Spain implemented an opt-out policy 40 years ago. There's been a significant increase in organ transplants since then that has inspired other countries, including France, the United Kingdom, to do the same. When it comes to organ donation, the default setting can make a huge difference. Thank you so much for considering this point of view.
Are there any questions for the witness? Seeing none, thank you very much for your testimony, and that concludes testimony on House Bill 5388, which brings us to Representative Carson's bill, House Bill 5392, which is an act related to education of planning board members, and it specifically says that local planning board or members or commission members are required to initial and biannual and to have initial and biannual continuing education in land use law and planning for local planning and zoning board members. Representative, the floor is yours.
Thank you, Chairman. You did a fine job of introducing my bill. The bill would create a training program for zoning boards and planning boards. I wanted to give you a little history of where this bill came from. About 4 years ago, we passed a bill that I sponsored, which created a training program for planning boards on the impact of sea rise and climate change. And that program was produced by the University of Rhode Island, and they produced a 1-hour video of 4 15-minute modules that have trained probably all our planning boards by now. And after the first year that program was in place, I started getting calls from different people telling me how much they really liked this program, that it was really effective. It was really bringing all the members of the planning boards up to one place in time to understand the impact of climate and sea rise. And they asked me if I would consider introducing a bill that really required a broader training for zoning boards, planning boards, and zoning boards this time. So that's sort of the origin of where this bill came from. And if you look on page 5 of the bill, for those of you that have it in front of you, it lays out that the program will focus on those areas of statutory responsibility for planning boards and zoning boards. Under state law, only 3 types of commissions really have statutory responsibility, and those are zoning boards, planning boards, and historic district commissions. And I know that there's some interest on the part of some of the planners in the state to amend this bill to include the historic district commissions. I was watching a planning board meeting recently, and I know that there were some new members appointed to it. And I thought to myself, well, they're on the committee or the board, say, 6 weeks, 2 months, 6 months, and they're really dealing with complicated legal issues. And the municipalities are liable for their decisions. And I thought to myself while I watched it that how useful it would be if these members had a foundation and a knowledge of what exactly their statutory responsibilities are. So the bill lays out that they would be trained, that there would be a history of the purposes of planning and zoning, what are state laws and local ordinances, overview of the functions of the boards, understanding basic property rights, understanding open meeting laws, and a series of topics that are really relevant to the types of decisions that they make. There are some exemptions, and the exemptions generally revolve around whether or not the members of the board had achieved academic success in these areas, or they had certifications in planning, or they had college degrees in planning that affected these topics, and so they would be exempted from the training. There would be an advisory committee put together under the State Planning Council, and that would oversee the program. So how would the program work? There's concerns that there's volunteers on these zoning boards and planning boards, and they don't really have the time to be trained. And I would argue that, if they put in the hours that the bill requires, which is in here, I was looking for it while I was waiting, it's not that much. I mean, it's like a couple hours, 2 hours of training, 4 hours of training a year. It's really not that much. And the Department of Administration and the planning folks over there, they were very open-minded and they were very supportive of the bill in the past. I don't know if they're testifying tonight. But they were interested in putting together either videos or webinars so that the members could do the training at their own convenience. That's how the climate change and sea rise training is. It's on a YouTube channel. And so those members can just go to the YouTube channel in their pajamas and watch the training program. And they can really have the knowledge and information that they need. The State Planning Council is also authorized to promulgate rules and regulations around this idea, and I think it's an idea that we should consider, one that will have consistency across planning boards. Another thing that's come up to me is that there are some folks that go before planning and zoning boards routinely in their work, like, for example, builders. And so the builder wants to build a house in East Greenwich, and he goes before the zoning or the planning board. And then he goes to build a house in East Greenwich. Then he wants to build a house, say, in North Kingstown, and he goes before the planning or the zoning board. And there's sort of different levels of comprehension and understanding in those two boards because folks come to the boards with different levels of experience. And the builders were supportive because they thought there'd be a level playing field. And so when different professionals have to approach the boards and the commissions, there would be a sense that they all have sort of common knowledge about how they need to operate. So I think it's a good idea. I hope you will agree, and I'm certainly willing to take any questions that any of the members have.
Any questions of Representative Carson? Seeing none, the first witness is Bill Walsh, Rhode Island Builders Association. Bill?
Yes, Mr. Chairman.
How are you? Good to hear from you. You are on the air.
Thank you, Mr. Chairman, members of the committee. Bill Walsh on behalf of the Rhode Island Builders Association. And we're here in strong support of H5392 by Representative Carson, and we thank her for her leadership on this issue. The decisions made by local planning and zoning boards have significant impact on the quality of life and economic vitality of our communities. As such, the Rhode Island Builders Association believes that requiring initial, biennial, and continuing education in land use law will greatly enhance the procedural and substantive decisions made by these bodies and thus improve Rhode Island. We think it's a common sense bill. We urge your support, and we thank you for your consideration.
Any questions of Mr. Walsh? Seeing none, that concludes. Oh, I'm sorry. Go ahead, Doc.
Bill. Oh.
That's okay. You just asked
No,
the question.
that's okay.
No, go ahead. You want to get him back? Okay.
No. I thought he was still on. I'm sorry.
Sorry.
Excuse me, Mr. Chairman?
Yes.
Could my attendance be recorded and my 2 votes be recorded in the affirmative?
So ordered.
Thank you.
Thanks for making this your 5th committee or something today.
Wow. Is it?
I don't know. Billy, Dr. Corvesi has a question for you.
Good evening, Bill.
Good evening.
Bill, just one quick question. Do you think this will discourage individuals from wanting to participate on these boards?
We would hope that, enhancing these or requiring this would actually improve the process and allow them to better enjoy and have greater confidence that the decisions that they make are well educated and informed. And so we think it's a benefit, not a detriment. We would hope that everyone who undertakes these important responsibilities as part of public service take them seriously. And as such, we think that providing them the resources to better do their job is an important tool in the kit. And we would hope that it would be embraced and not discouraged.
So when I hear the phrase, we would hope, you're not sure?
There's a lot of different people who serve on these boards. We would say that, I think providing resources, many people who are called into public service would embrace the fact that there's an additional set of resources and standards available to them so that they can feel more confident in the roles, responsibilities, and actions they undertake. So if you're asking my personal opinion, I believe that many people will view it as a positive thing. I'm sure there are others who, wouldn't want to be burdened by different things or believe that they already know everything. But I know one thing: I learn something every day, and I, strive to always be better educated. And so I hold that as a premium.
Well, let me just say that it's hard. You'd have to be hard pressed to vote against continuing education. But I just wanted to bring that up. Thank you.
Bill, there's one more question for you, Bill, from Representative Plates.
How are you doing, sir?
Good evening, Rep.
Hey, I just got a question. Is there existing curriculum out there for these planning boards to use, or is that going to be part of the legislation? I mean, is that part of the legislation as I read it? Do you know of any? Or is this something we're going to have to create from scratch?
I certainly would defer to the distinguished representative whose bill it is to answer first.
Yeah, I do. GrowSmart has a curriculum that they use. They have done some training with planning and DOA. So there was a basis of some kind of a curriculum there. It wasn't required. It was really on a volunteer basis.
So they
and I believe the League of Cities and Towns has some additional resources as well that they circulate with local officials as well. But this would help us really put together a more comprehensive and formalized plan.
What would happen? So honestly, we've had planning board members that have stayed on for a decade and a half plus. What happens if the person gets to the point where they've exhausted the available curriculum, which I honestly could see possible? I mean, if it's every 2 years, you're talking, like I said, I know a guy that was on there for about 20 years. I mean, is the curriculum robust enough to be able to support that for long periods of time?
I don't think so.
I would contend that the scope of issues that are currently available, as well as the evolution of items that continue to be updated, including sea level rise and other important factors that are really hitting a lot of our coastal communities, are examples of things where there's constant improvement, and thus it's important to be up to date with those things. As another aside, as an attorney and practitioner in municipal law in different aspects, I would note that even familiarity with Robert's rules and the basics of the underlying statutory authorizations for what the scope of your board is responsible for, those are always worth updating and making sure you are constantly familiar. So even if you've spent a large career in public service in this role, it's always helpful to be reminded of the standards, the processes, and the updated substance as it relates to the scope of your responsibilities.
You sound like a very good lawyer.
He is. All right, that's if there's no more questions, that concludes testimony on House Bill 5392, which brings us to Chairwoman Williams' bill, House Bill 5378. It's an act related to insurance, Child Support Intercept Act. It expands the child support interception of insurance payments to include life insurance proceeds payable to non-custodial parents who are the beneficiaries of the policy. I did see Representative Williams here. She just stepped out. There she is. All right. Chairwoman Williams, You are on the podium.
Good evening, Chairman, and thank you for the opportunity of being able to be before you this hour. And I thank you for all of you that are still here being champions on behalf of your constituents and the state of Rhode Island residents. 5378, this act would expand child support interception of insurance payments to include life insurance proceeds payable to non-custodial parents who are the beneficiaries of the policy. I introduced this bill to close a loophole that allowed individuals who refuse to pay child support from collecting life insurance payments. Currently, they are barred from receiving liability and workers' compensation payments if they fail to pay child support, and it is only right that these individuals' payment from any life insurance policy also be given to the children that they refuse to support. Plain and simple.
Any questions of Chairwoman Williams, the sponsor of this bill? Thank you. There are no witnesses that have signed up, so that would conclude testimony on Chairwoman Williams' Bill 5378, which brings us to House Bill 5389, sponsored by Representative Alzadi. It's an act related to property, Residential Landlord and Tenant Act. It amends the Residential Landlord and Tenant Act to allow a landlord prior to any residential rental agreement shall deliver to the prospective tenant a valid certificate of rental suitability as defined in the general laws effective July 1st of next year. Representative Alzadi.
Thank you, Chairman and members of the committee. So this bill is pretty straightforward. All we want to do is we want to make sure that any landlords who have rental properties will just be able to give a certificate of inspection to their new tenants. This would not cost the city anything. It would go directly as the cost of the landlord. And it's just to make sure that they are keeping up with all the things that are necessary for a safe living space for their tenants. Thank you.
Any questions of the sponsor by the members of the committee? Seeing none, the first witness is Tanya Nuna. Tanya Nuna?
Hi.
Hi, how are you? You're on the air.
I'm doing well. All right, thank you. So I just wanted to take a few minutes of your time to speak in support of this bill. So, I mean, there's plenty of evidence out there indicating the link between housing quality and health of individuals throughout our community, but especially of particularly vulnerable groups such as children and the elderly. So everyone needs safe places to live, but with the current system of code enforcement that we have in Rhode Island, the system that a lot of municipalities are using, which is based on complaint systems, you know, these systems often do not catch the majority of code violations that occur, and oftentimes, you know, when they do catch these code violations, it does little good for anybody. You know, it puts penalties on landlords who may not have the financial resources to, you know, conduct the renovations needed to address the issues. And also, I mean, at that point, those issues may have deteriorated to the point at which, you know, they have become significant health hazards for the renters living in those units and for other people living nearby. So instead, I would contend that through this legislation, we should enable Rhode Island's municipalities to use proactive code enforcement systems to incentivize rental property owners to maintain their properties in good condition. And I think that this sort of enabling legislation would allow renters to have safe places to live, and therefore will be able to live healthy lives. And then it would also preserve our state's affordable housing stock. And this would also benefit rental property owners who have been for years been maintaining their property in good condition, and bring other rental property owners up to that standard and create a fair playing field for them. Lastly, I'd also like to point out that with this bill, it would create more business for private home inspectors who are working in the state. So I'd just like to conclude by urging the committee to vote in support of this bill. This type of enabling legislation would enable our state's municipalities to take the necessary action to preserve the long-term quality and affordability of our state's housing stock. Thank you so much.
Thank you very much for your testimony. Yes, Doc, you had a question?
Yeah, with all due respect, this is not enabling legislation, if I read it correctly.
Yes.
Am I correct?
You're correct, yeah.
Now, if you want to change the bill to make it enabling for a municipality, that's one thing. But this, and I understand what Representative Alzate wants to do, I give her a lot of credit. But especially in this day and age when people are being taxed into oblivion, and there are more rules and regulations than you have hair on. Well, it wouldn't be a lot to have more hair on my head, but you're putting quite an onus here on the landlord. And again, this is not enabling. So, just want to bring that point up.
Well, Representative Alzate, if that's your intention, talk to me on Thursday when we see each other again on the floor, and I'll be happy to give you some direction and some help on that. Okay?
Yes, thank you.
You're welcome. All right, the next witness on this. Oh, I'm sorry.
I have a question for the
Representative
sponsor.
Vella Wilkinson.
Representative Alzante, so am I reading this correctly? It's almost as if the apartments would have a certificate of occupancy. There would have to be an inspection conducted, electrical and so forth and so on. So wouldn't that come from the towns and cities, from their building officers? Who would you envision to be conducting these inspections?
So it wouldn't be at the cost of the cities or the municipalities. It would come as the cost to the homeowner. So they would have to find their an inspector, and then they would be paying for this out of pocket, and then they would be providing the certificate to their tenants.
So it would be similar to a certificate of occupancy, is that correct? Like if someone was selling their home and they had to have it inspected before the sale?
So I'm going to say, I understand what you're saying, but I don't think it's the same thing, because this is also every 5 years, if I'm reading it correctly myself. So I think that the intent is kind of similar to what you're saying, but I don't think it's quite that.
Okay. And you don't think that the landlord would push the cost onto the tenants and make this another fee that a prospective tenant would have to pay?
So, I mean, that is a concern that we have, and that's definitely something that I'm willing to work with, so that we don't provide that to the tenants. So that, we already know we have a housing crisis, and the last thing we want to do is raise the rent more than it's already so high. So definitely something we can talk about.
Okay. I look forward to talking to you about it. Thank you. Thank you, Chair.
Thank you.
Thank you. The next witness is Jordan Mickman. Jordan?
Yes.
You're on the air testifying before the House Judiciary Committee, and before I let you go on with your testimony, you will be the first witness on the next bill, so if you stay on the line, I'll have Representative Alzate introduce her next bill, and then you'll be the first outside witness to testify. Is that okay with you?
That sounds great. Thank you.
Okay, fire away.
So, Chair Craven, thank you for taking my testimony. I'll try to be quick till late at night. And thank you, Representative Alzate, for introducing this bill. My name's Jordan Mickman. I'm the supervising attorney at the Rhode Island Center for Justice. And much of my work at the Center for Justice revolves around representing low-income tenants who are engaged in disputes with their landlords. They're people who are living in substandard apartments. They have illegal attic units, illegal basement units, lack of heat, unsafe electrical equipment. And in Rhode Island, it's a real challenge to resolve some of these problems. And the bill that's before the committee is essentially a consumer protection statute that would flip the burden upside down. Right now, the way things work is a tenant goes and they walk through an apartment, and then they're obligated to let the landlord know whether or not it meets acceptability standards, and they sign off on a form, and then they tell the landlord, no, it's fine, and therefore I guess it's fine, as if they're certified to check the electrical equipment or even know where the boiler is located. So what this does is says, just like the way a restaurant has to convince its diners that it's been, it's healthy and safe to eat at by having an inspection beforehand, this requires a landlord to do the same thing. And the real course underlying this bill is that renting residential property is serious business. It impacts people's health and well-being, and frankly, there is virtually no bar to entry. There is no requirement for learning or engagement of fair housing standards. Nobody has to learn about plumbing and electrical standards. Nobody has to learn about finance. Anybody can do it, and in fact, it's encouraged on HGTV, and everywhere we look, everyone's flipping properties, getting it on the real estate market. And the truth is, children, pregnant women, and families are exposed to vulnerable circumstances that impact their health. Mold, lead, and all sorts of other toxic circumstances are making people unhealthy. And all this bill does is require a very simple thing that's already routine in virtually every other real estate transaction. When a home is sold, everyone gets a home inspection. Rhode Island recently required home inspectors to become licensed. We expect restaurants to be inspected before we eat in them. There's no reason that we should think this is such a big deal. The landlords and the realtors are going to complain about the costs, but I'm not going to lie. There are obviously costs involved with this. Substandard housing has costs involved with remedying, and there are certainly costs involved in doing the inspections, but the cost of not doing any of this is far worse. And I'm all ears and willing to work with all of the interested parties. Obviously, improving the conditions of housing in Rhode Island is a serious challenge. The housing here in the state is quite old. But again, this is a pretty neutral barrier. What it does is it places municipal government in charge. They're already in charge of enforcing the code. But what this does is, instead of requiring them to go out and affirmatively inspect every single property, it creates a system where landlords will certify once every 5 years that the property meets minimum housing standards. And I just want to close by saying this past year, so many of us have been spending virtually all of our time at home. We're learning at home. We're eating at home. All of our families are in small places, and the housing that we're living in is it's so important. And moreover, this past year, it's been especially difficult to get code enforcement to do inspections, to get contractors come out to make repairs. And what this is doing is making landlords do what is already required of them. It's creating no new standards. All it does is create a system to ensure the standards are being met. And I can tell you I would not be so animated about this if it did not keep me so busy in my day job. So I'll close with that, and thank you, and take any questions.
Any questions for the witness? Seeing none, hang on, Jordan. You're going to be back up in a second. That concludes testimony on House Bill 5389, which brings me to the second bill on the Alzate agenda tonight. It is House Bill 5391. It is an act related to property, residential landlord and tenant act. It provides for the sealing and unsealing of court files in residential eviction proceedings, effective January 1st of next year. Representative Elzadi.
Thank you, Chairman. So this one seems pretty straightforward. So what we want to do is, currently the way that the system is set up, if you are a tenant and you are being evicted for, say, something that is really not your fault, the moment that your landlord starts the eviction process, your name goes into what I call this portal. And without any judgment, your name is now in this portal, and it seems like you have kind of like a target on your back. And so when you want to move out and you are trying to find another apartment or another place to live, property managers or landlords can just kind of Google your name probably, or, go into this portal and see if you have any evictions and your name shows up. The problem with this, as it stands, is that there might not be a judgment. And even if you are not found guilty of whatever you're being evicted of, your name still stays in this portal. So this is, so what we want to do is we want to make sure that your name is not going to go into the portal unless the judgment is against you, against the tenant, right? I got that right. So if the judge rules in the landlord's favor, your name goes into this portal, and and it's going to explain as to why, and all these things. So what we want to do is we want to make sure that the tenant's name do not go into this portal until there is a judgment that is in the favor of the landlord. So we want to make sure that people don't have a, just creating another barrier for housing. I think Jordan can explain this a lot better than I just did, but I will do my best to answer any and all questions.
Any questions of the sponsor? Seeing none. Jordan, you're up again.
Again, thank you, Chair Craven. I'll make this quick again. My name is Jordan Mickman. I'm a supervising attorney at the Rhode Island Center for Justice, where I spend most of my time representing low-income tenants who are engaged with landlord-tenant disputes, including defending evictions. And again, our written comments can speak for themselves, but I would just like to bring up the context. This year, so many people have ended up in eviction court. Our office has been just flooded with phone calls, and it really just demonstrates that this eviction can impact so many different people in so many different ways, and they really do have long-term consequences. The credit reporting agencies are really misunderstood by much of the public, and there's a lot of different credit reporting agencies that do a lot of different things and gather information in a lot of different ways. And what this bill seeks to do is essentially say, look, if somebody hasn't been tried by the court yet, they haven't been found to have violated the law yet, it's not really that relevant, meaningful information. It's not that there's no relevant, reliable information in that, but the idea is that the harm that people are having by this is so serious. People have a pending eviction against them. They cannot actively even relocate. So if somebody's withholding rent under the law, they're allowed to withhold rent to seek alternative essential services. That's a remedy provided by Rhode Island law. They're allowed to repair and deduct certain things below $125. If they do any of those remedies, they're vulnerable to being the defendant in an eviction case. So if they're following Rhode Island law, they might end up with an eviction case pending against them. And if the solution that they choose to take is just to move, they're like, all right, I don't want to deal with this landlord, I'm just going to move. Well, right now they're applying to apartments with an open eviction case against them, and they've done absolutely nothing wrong. And what this law will do it will make those records public when the landlords win, when there's a judgment in favor of the plaintiff and against the defendant. Of course, that's a judgment that must become public. It will, of course, be gathered by credit agencies and anyone else who wants it. But in all these other instances, these cases won't be scooped up and they won't be used against people while they're seeking housing in the future. And I just want to say, in this country, we become so reliant on credit checks, background checks, and all of these things. They're tools used to oppress my clients and prevent them from having housing and jobs, to benefit by mitigating the risk of landlords. So, you know, in France, it's illegal to do credit checks for anything. Like, the policy decision isn't even on the table in this country to consider that. What we're asking to do here is limit the availability of eviction records in a really narrow situation because we know they're hurting people every day, and nobody's really relying on these open court records in a meaningful way to mitigate their risk in a way that's worthwhile. So that's the justification behind the bill. Sorry it's so late. Thank you for taking our testimony. Happy to take any questions.
Any questions for Jordan? Seeing none, the next witness is, oh, does somebody have a question? Oh, I don't see, oh, here he is, yeah. I'm looking at the screen and you're not on there, you're in front of me. Jose Batista.
Thank you, Chairman. I just wanted to say thank you to the attorney who just testifying. I am a big fan of the Center for Justice. I remember being at the Public Defender when the Center for Justice was created and it being described as almost like a civil public defender. So I'm grateful for the work you do. And I was actually just having this conversation with a client the other day, somebody who's been on the wrong side of an eviction for reasons that they probably didn't deserve. And so I really appreciate this effort. And in all seriousness, I'm wondering if we can work on a similar bill for traffic tickets, because I've got a whole bunch of clients in that boat as well. You know, you get into the situation and folks are looking you up into the system, and if they don't know what they're looking at, you know, if you got an eviction or two or a traffic ticket or two, next thing you know, maybe they think that you're some sort of criminal mastermind that you're really not. And so I appreciate your effort on this, and hopefully we can work on similar bills in the future.
Thank you. Any other questions of Jordan? Okay, now we'll go to the next witness, Christina Contreras-Fox. Christina, you're on the air.
Hello. Good evening, everyone. Good evening, Chairman Craven and members of the House Judiciary Committee. My name is Christina Contreras-Fox. My pronouns are she, her, ella, and I am the Senior Policy Analyst for the Rhode Island Coalition for the Homeless, a dynamic coalition that works to create and advance lasting solutions to end and prevent homelessness in our state. The Coalition for the Homeless proudly supports Rep. Alzate's bill, H5391, since this bill removes a significant and unjust barrier to accessing housing. So eviction makes housing so much harder to access. Simply put, is one of the root causes of homelessness. An eviction proceeding, even when the verdict goes in favor of the tenant, can have lasting damage on an individual and her family's housing stability. Eviction negatively impacts one's credit, and prospective landlords may not rent out a property to someone with a prior eviction, regardless of the decision in court. And passing this bill in this moment is absolutely critical. Due to the pandemic, data estimates that as many as 44,000 to 62 Rhode Island households, which represent as many as 100,000 to 143,000 residents, may currently be at risk of eviction. And while the CDC moratorium is in place until at least March 31st of this year, this moratorium only applies to eviction for non-payment of rent, meaning that's the only protection it gives. And unfortunately, there are landlords who are trying to get around this policy by evicting tenants who aren't even in arrears for other reasons. But even prior to that, Rhode Islanders served through the Coalition for the Homeless legal clinics detailed going through an eviction process for something as simple as requesting basic tenant repairs or requesting basic repairs to their rental units. And that's something that gets held against them as the law currently stands. Now, if a tenant goes through the stress and uncertainty and the trauma of an eviction with the verdict decided in their favor, that eviction should not cause them nor their family further damage. On any given night, there are over 1,104 Rhode Islanders experiencing homelessness. We have folks who are sleeping outdoors, sleeping in cars, families tucking their kids in at night in the back seat of a car when it is freezing outside. And too many of them are there because of an eviction or because they can't find another apartment to rent due to a prior eviction on their record. This is the reality, but we can change it. And this bill is a critical step in that direction. So we urge the committee to send this bill to the House floor with a recommendation of passage. Thank you very much for your consideration and happy to answer any questions.
Any questions for the witness?
Chairman, I just want to thank Representative Alzate for her leadership on this bill. I think it's an amazing bill and it's what we need at this time. And I just want to thank Representative Alzate.
Thank you very much, Representative Casimiro. Okay, next witness is someone named Joshua. Joshua?
Yes.
You're on the air.
Thank you, Mr. Chairman, and members of the committee for allowing me to speak this evening. My name is Joshua Nault. I'm a public interest attorney with the Rhode Island Center for Justice, along with Jordan Mickman, focused primarily on eviction defense and housing law. I'm excited to speak tonight in support of House Bill 5391 because an eviction on a tenant's rental record is often the most difficult barrier to securing a new rental unit. As everyone knows, evictions can happen for different reasons, but in Rhode Island, the person who is sued for eviction is subject to immediate reputational damage from the time of filing a lawsuit. Not only is this unfair for the tenant who, at that point, has not had an opportunity to answer the complaint or challenge the validity of the action, it also undermines the goal of the plaintiff landlord by automatically creating an impediment to the defendant tenant finding new housing. To clarify, if the goal of most evictions is to remove a tenant from the property and the tenant's reputation is harmed as a result of the eviction simply being filed, then the plaintiff landlord necessarily impedes their own expedient recovery of the property by making it harder for the tenant to relocate. This can also contribute to protracted eviction proceedings and an unnecessary and preventable loss of unit marketability. Of course, a landlord has an interest in knowing to whom they're leasing a property, and House Bill 5391 does not inhibit that interest in any meaningful way. Indeed, the interests which support the kind of judicial transparency that landlords require are primarily interests of health, safety, and financial stability of the tenant. Since financial stability is easily determined by credit checks and income verifications, the primary interest in judicial transparency for landlords become health and safety. House Bill 5391 permits for those interests to be protected because if the eviction is based on the tenant's risk to others' health and safety, there's little chance that the eviction would be settled or resolved outside of formal litigation. This bill also accommodates and protects these interests because eviction actions which end in judgment against a dangerous tenant are automatically unsealed and made available to potential future landlords. Another common occurrence in eviction actions is when the case is settled by agreement between the parties. Importantly, actions that end in settlement that are not technical evictions, but are amicable resolutions to the lawsuit entered into by the parties. Our district court in Rhode Island often encourages settlements between parties, and as such, a significant amount of eviction actions brought in the district court end in amicably resolved agreements that result in something other than actual eviction. Nonetheless, without this bill, those resolved actions remain viewable to potential landlords and are often made available to landlords through private service providers who often fail to provide the context behind a person's eviction record, such as the amicable resolution of the matter. House Bill 5391 would also preclude misreporting of by these private reporting service providers because, according to the bill, settled cases are sealed unless and until the parties fail to abide by the terms of the settlement. Even more, if such a circumstance occurs where there is noncompliance, the record can be unsealed and made public for any future landlord to view. For all these reasons, I am in favor of this bill, and I strongly encourage and respectfully request this body to pass the bill so that tenants' reputations could be more protected than our current system allows. Thank you again for allowing me to speak, and I'll be happy to take any questions.
Any questions for Joshua? Thank you for your testimony. The last witness on this bill is Randall Rose. Randall? Randall?
Yes.
Randall, you're on?
Yes, thank you.
Randall, before you testify, we're getting late. Could you confine it to like 3 minutes or so?
Yes.
Thanks.
Yes, I will be brief. Thank you, Chairman Craven and members of the committee. I, too, am in support of the bill. And I think people have given plenty of good reasons why it's a good bill. It is simply a way of making sure that people who have an eviction filed against them where the eviction does not deserve to prevail on the merits don't become unable to access housing as a result. And I think that all the people of Rhode Island have an interest in making sure that people can access housing, and nobody wants to see the homeless population increase. No matter what your views are about homelessness, nobody wants to have a much higher homeless population than we already have. We'd like to have a smaller one. This reform will ensure that people who have an eviction action filed against them that does not deserve to prevail on the merits will not be made homeless as a result. So I hope that everyone will support this bill. Thank you.
Thank you very much, Randall, for your testimony and your brevity. And that concludes testimony on House Bill 5391. Representative Elzadi, great job. Thank you. You're bringing up some difficult issues that have been exacerbated by the pandemic.
Thank you, Chairman and members of the committee. I hope to continue to work on this legislation with all of you.
I'll see you Thursday. We'll talk about it.
Okay. Yes.
All right, the next bill is House Bill 5573, sponsored by Representative Norrie. It's an act related to property residential landlords, and it particularly requires a landlord to obtain and have in full force and effect a general liability policy of at least $100,000 for those persons injured on the property on the premises due to the negligence of the landlord. Representative Norrie, the floor is yours.
Good evening, Chairman Craven and esteemed colleagues of the Judiciary Committee. I'm before you this evening to testify on behalf of H5573. Bill adds the following requirement to Rhode Island General Law 34-1822, which falls under the Residential Landlord and Tenant Act, and will additionally require everything that the chairman said, so I will not repeat it. It's a $100,000 liability policy for negligence of the landlord. That is the testimony on the bill.
Any questions of the sponsor? Seeing none, we have one witness that signed up on this bill.
Thank you, Chairman.
Thank you very much. It is Mark DeSisto. Mark, are you on the line?
Yeah. Yes, Mark speaking.
Mark, you're on the air before the House Judiciary Committee.
Thank you very much, Mr. Chairman, and members of the committee. My name is Mark DeSisto, and I'm here for the Rhode Island Association for Justice. This bill by Representative Norrie is a tenants' right bill. This bill requires landlords to have an insurance liability policy on property that they own in at least in an amount of at least $100,000, and to provide a copy of the declaration page to the tenant with the lease at the start of the tenancy. This would also require them to provide the tenant with a copy of the renewal of the policy during the term of release. Now, most landlords have insurance in effect, but some don't. If you don't, excuse me. Let me start over. Excuse me. Sorry about that. Most landlords have insurance in effect, but some don't. And our members estimate that as many as 10% of landlords don't have insurance on their properties. In some instances, the landlords let the insurance lapse after a year and they don't renew. This bill addresses that situation. We believe that this bill levels out the playing field by requiring all landlords to have insurance. Another argument that I'd like to say is that car ownership requires insurance. So we believe that ownership of a rental property should also require the same insurance.
Okay.
Thank you very much for your time, and I'll answer any questions that members of the committee may have. Thank you.
Any questions for Mark? Seeing none, that concludes testimony on House Bill 5573, which brings us to Chairwoman McEntee's bill, or first bill, House Bill 5559. It is an act related to health and safety, particularly abuse in healthcare facilities. It removes the intentional element in the definition of abuse and or neglect in the abuse and health care facilities law. Chairwoman McEntee.
Thank you, Chairman. These bills, I was asked to put these in by the Trial Lawyers Association. Both of them are aimed at elder abuse in our nursing home and healthcare facilities, especially assisted living and nursing homes. Intentional was taken out of the language of, what number are we on? 5559, to allow for more behavior and evidence-based prosecutions of this kind of activity. And I would say that both these bills, and I'll speak just to this one first, are a reaction to the COVID-19, where people have not been able to get in to see their loved ones, their elderly loved ones in nursing homes and assisted living facilities. And this is just a way to protect the loved ones from abuse. So with that, I believe we have some witnesses.
Any questions of the sponsor? Chairwoman, would be all right with you if we put the second bill in play?
That'd be just fine,
And then
Chairman.
Scott Frazier, who's the first witness, can testify on both of them. Okay, the next bill that we will include in the McEntee portion of this agenda is the act related to health and safety, electronic monitoring in nursing and assisted living facilities. It allows for the use of electronic monitoring of a resident's room or private living unit within a nursing home or assisted living facility.
Again, this bill was, I was requested to put this in by the Trial Lawyers Association. And again, it's aimed at elder abuse in nursing homes and assisted living facilities. This one requires the electronic device, surveillance device in the room, but it has to be with the consent of the patient or the patient's guardian. And if there's a roommate with that patient, they also have to consent, or the electronic device will not be used. Again, this is COVID-driven. People can't get in to see their loved ones. They don't know what's happening. Getting updates from the facilities when you can't get in to see your loved ones is very difficult. My family is going through that right now, where my husband's sister is in a nursing home. And other than phone calls and trusting what they tell us, we have no idea, because we have not been able to get in since March. So, well, occasionally they've been able to get in, but more recently, in the last several months, there's been no visitation, and now there's limited visitation. But anybody who has a loved one in a nursing home or assisted living, you know what I'm talking about. So with that, I believe we have witnesses to testify to this as well.
Thank you, Chairwoman. The first witness is Scott Frazier. Scott, are you on the air?
Yes.
Good to hear from you. I'm going to ask you that you can testify on both bills, 5559 and 5561.
Absolutely. And we're ready to go, Mr. Chairman?
Ready to rock and roll.
Thank you, Mr. Chairman, members of the committee. My name is Scott Frazier. I'm President and CEO of the Rhode Island Healthcare Association, and we represent 63 of the nursing homes in the state of Rhode Island. And the Rhode Island Healthcare Association is opposed to both of these pieces of legislation, and I'll take them one at a time. 5559, this makes the language of the statute much too vague. Keeping the word intentional makes the definition very clear. I'd ask the question, who determines that someone is engaging in this pattern of abuse or is, quote, failing to provide services? As an example, what about a resident-to-resident situation? Someone with dementia or cognitive disability, they could be acting out, not intentionally causing harm, but another resident or family member could claim that it is causing harm to their loved one. For instance, the resident might sing or yell loudly and not intentionally causing harm to anybody, but someone else could claim that it is causing harm to their loved one and it's bothering them. What about a staffer who simply forgets to do something? Maybe a cafeteria worker who accidentally skips a room with a food tray. That's not neglect, it's a simple oversight that's easily corrected when the error is pointed out.
Under this change in the law, the worker in the facility could be in serious trouble for what amounts to a simple error. It greatly lowers the threshold for abuse, and it doesn't add any more protection to the resident. I'd raise the question, what problem is this fixing? Rhode Island doesn't have a problem with abuse in our homes. Our quality is ranked quite high, and I'm going to address that a little bit more in the next bill. But whenever anyone has a complaint about a situation that's either intentional or not, it is immediately investigated by the Department of Health. Usually, thankfully, there's no finding of wrongdoing, but if there is, an immediate plan of correction is ordered, and in some cases, there are monetary penalties as well. These protections were already in place. If there is intentional harm or abuse or neglect, then by all means, those cases should be aggressively investigated, but removing that word will lead to numerous unnecessary investigations. Now, in 5561, we're opposed to this imposing or installing cameras into residents' rooms for a number of reasons. First of all, it's the dignity of our residents. The nature of the care we provide is intensely personal. Nursing home residents typically need assistance with bathing, with dressing, with using the bathroom. And even if a resident and their roommate agree to this filming, it's an intrusion on each resident's privacy. And does any of us really want to be filmed in our bedroom or our living room? Another reason we oppose this is the quality of care. Rhode Island's at the top of the charts in many national rankings. The most recent report from the U.S. Government Accountability Office ranks Rhode Island #1 in the nation for infection control. In a report by the U.S. Office of Inspector General, Rhode Island was found to have the lowest number of inspection deficiencies of any state in the nation. And in 2019, America's Senior Health Report ranked Rhode Island 2nd in the country in overall quality. And I understand the sponsor's concern and also the trial lawyer's concern about the lack of visitation during COVID. But as we all know, that was not in any way to punish the residents or the families. That was an attempt to battle this terrible disease and this terrible illness. Nursing homes in the state already have dozens of cameras in place in common areas. And as stated above, abuse of residents, thankfully, is not a serious problem. Another reason we oppose cameras in the rooms, relationships between staff and residents. Families want our staff to develop relationships with their family members to be compassionate and spontaneous. The bill would greatly impair personal conversations between nursing assistants and their residents. Our staff just wouldn't talk to residents about personal matters in a room when they know they're being monitored and recorded. And it's very hard to develop these relationships when you're under 24/7 video surveillance. Another reason is the potential for hacking. We've all heard about pedophiles hacking into nursery cameras that monitor young children and the nightmares this has caused for the kids and the parents. And no one wants to see a repeat of this with hackers getting into nursing homes' private room cameras. There are other issues, and I know it's been a long night, just briefly opting out of camera use. If a roommate refuses to give permission and the other roommate's family wants a camera, one of them will have to be moved. And such a move is very unsettling for a frail, vulnerable nursing home resident. There are other points. I'll let it go at that. I believe there are other witnesses, Mr. Chairman, but I thank you for your time. I thank you all for your patience and your stamina tonight, and I'm happy to answer any questions.
Thank you, Scott. Any questions from Scott, on either of the two bills? Yes, go ahead.
Thank you, Mr. Chairman. Scott, I just wanted to say, like, one of the problems that people are having with nursing homes and assisted living, if they can't see their loved ones, they're hearing from them on the phone, and they're very distressed, and there could be accusations of all sorts, and there's no way of knowing what's true and what's not true. So in that way, I can see why there's a desire to have some evidence as to what's going on. Because if you can't, if you can get in to look at the person that you care about, you can see whether or not they're distressed, and many of them are stuck in their rooms. They're not even getting to these common areas that you talk about that have cameras. Right. My sister-in-law is one that she never gets out of her room. I mean, up until maybe recently, but they were strictly confined to their room. So you can only imagine the complaints that people like my family are hearing, and have no way of checking it out. So
no, I absolutely do.
I don't think you understand the distress that it has on everyone, and that's why I think the reason for the bill came about. But just to have some reality check on all of this. No,
Representative, I do understand the stress this puts on everybody because our members here and have been hearing from family members every single day for the last year. There is concern, and our staff will do our best to put the resident and the loved one on the phone, or to set up video conference, to do all kinds of as much contact as we possibly can. And you're right, there are for many occasions, the residents have been confined to their rooms, but that is something that we've been ordered to do by the Department of Health. These are not voluntary sanctions or voluntary restrictions that nursing homes have put on. We would love to have visitation. We'd love to have people coming in. We would love to have our residents have the contact with the family members that means so much to both sides. We can only go by what we're told to do by the Department of Health, by the Centers for Disease Control, and by Medicare, and that has constrained us. But I can absolutely assure you we've heard from family members on a regular basis, and we know the concern and appreciate that. And as I say, when family members have had concerns, they will contact the Department of Health. Whenever there's a complaint survey, the DOH comes in immediately and inspects and checks out the accusations. And thankfully, there have been very few of those that have been found to be founded. But I do absolutely understand the concern of the family members.
Well, I think it's difficult for both sides. You've been under orders to do certain things. Everybody's been told to stay out. It's like a three-way terrible situation for the patient,
yes,
the facility, and for the family. So
I couldn't agree with you more.
And I totally get that you guys just had to do what you had to do, and so does everyone else. But it's an awful situation. And it's doing a number on the patients as far as I can see. But
yeah.
Anyway,
thankfully
thank you.
the numbers are getting better, and we hope the restrictions on visitation are going to continue to ease up. I think that will go a long way to helping all parties. But you're absolutely right. It's a three-way terrible situation. I agree with you 100%.
Hey Scott, this is Julie Casimiro, and I just wanted to echo Chairwoman McEntee's comments. I think that you guys are doing a great job, and my sister and I say it all the time that we're thankful that my mom is not living under these conditions right now. But I wanted to just say that you guys are doing a great job. So I echo Carol's comments.
Thank you, Representative. I appreciate that.
Second Vice Chair Jason Knight.
Thank you, Mr. Chairman. Scott, I don't have a question so much as just a comment on the abuse bill. You know, I signed the bill, and the thing that struck me that the bill was trying to fix was just removing the word intentionally, which is just as vague as the replacement drafted language. The bill, frankly, the version that it's in now in law is not great, because intentionally is a wide open word, and then removing any state of mind from the offense is not great either, particularly when those definitions can play into a criminal penalty, which it can under that statute. So I would advocate, if we were going to do something with this, that we would adopt the well-worn, you know, many hundreds of year old criminal standards of putting in some kind of state of mind into the bill along the lines of knowing or willful or recklessly in exchange for intentionally. So like I said, I signed on to that bill so we could have a conversation about that. And I just want to put that on the record. I think that there's some work to be done there. The camera bill is a good idea. I understand the need for loved ones wanting to view their families these days. I think that the intent of the bill is honorable. It could be pared down and skinnied up a bit to try to create something that's easier for the nursing homes to comply with. But I think both bills represent an effort to fix the problem in current statute. Thank you, Mr. Chairman.
And Representative, as always, we're happy to work with you or anybody else just to further discuss this legislation.
Okay, thank you, Scott. While we get the next witness up, which is Jim Nyberg, I would just announce that concludes testimony on House Bill 5559, which leaves us with 5561. And Jim Nyberg, you are on the air.
Thank you, Chairman Craven. I'll be brief. Thank you, Chairman Craven and members of the committee. Leading Age Rhode Island represents both nursing homes and assisted livings, and we appreciate this opportunity to express our concerns about this bill. First, we share the same interest as all of you in protecting the health and safety of our residents, but there are several issues that we want to highlight that in regards to our opposition. First, I just want to assure the committee that these providers already follow numerous regulations and policies to promote resident safety, and also required, as Scott had mentioned, to report any suspicion of resident abuse to the health department, the police, and the long-term care ombudsman. And they are regularly visited by the health department, so there are eyes and ears in there. But Rep. McEntee, like you and Scott were discussing, we know these are not ideal circumstances. They're trying to do their best with visitation under federal and state protocols. And hopefully there'll be a light at the end of the tunnel, but in the meantime, they're doing a lot in terms of virtual visits, Skype, FaceTime, and whatever they can do. But in regard to the idea of placing monitoring cameras in residents' rooms, we think it raises both practical and philosophical concerns. On the practical side, most rooms, at least in nursing homes, are shared occupancy. So if one resident doesn't want surveillance, it would be almost impossible to protect his or her privacy. And the idea of moving residents around based on this is not really appropriate or practical. We try and make their space their home. On the philosophical side, cameras would be an intrusion on residents' dignity and privacy. Our providers have committed to resident-centered care policies to promote a home-like environment. But installing video cameras to monitor every move a resident makes would be intrusive and sort of add a big brother feeling to our nursing homes and assisted living residents. The staff in our organizations are committed to the health and overall well-being of our residents, as evidenced by their dedication during this whole pandemic. So we think that this bill does raise some serious concerns about resident rights, privacy, and dignity, which is why we were respectfully opposing it. Thank you for your time.
Thank you, Jim. There's no questions for Jim. The next witness will be Randall Rose. Randall, you're on the air, and same request, if you wouldn't mind.
Yes.
3 minutes, thanks.
Okay, so thank you, Representative McEntee, for introducing this bill. It's a very good bill, and has and drafted with care and concern for the wide variety of situations that can come up, despite what the nursing home speaker may have said, the bill takes a good deal of care to make sure that recording devices and cameras are only installed at the request of the resident or the resident's representative, and if the resident's representative is involved, the resident has to be consulted in person, and the same goes for any roommates of the resident. There are a number of problems that come up in nursing homes when you have a person who is who's not able to be fully physically active. They do need some protection at times to ensure that their dignity is respected and that they are treated with respect, and they do have a perfect right to record people in their room, which is their home, as long as their roommates agree. And this bill takes care to make sure that their consent and the consent of the people in their who are their roommates is obtained. It makes sure that the residents and their roommates have the right to say which situations the recording device should be turned off for, or the camera should be turned off for, and it allows strong procedures for revoking consent and for removing the camera when a new roommate is moved in, unless the new roommate consents. So it's a very well-designed bill. If you want to protect the dignity of nursing home residents, this is the way to go. It does not create a Big Brother situation for a lot of nursing home residents. Being able to record their treatment to substantiate complaints can help them get relief from what may feel like something close to a Big Brother situation already. So I do hope that this bill will be passed, and that I appreciate it being put in. Thank you.
Thank you, Randall. If there's no questions for Randall, that concludes testimony on House Bill 5561, which brings us to House Bill 5399, sponsored by Representative O'Brien. It's an act related to gambling and lotteries, and it allows social gambling in private residence and in public taverns or private clubs as long as the gambling is incidental to a bona fide social relationship between the participants, and no person other than the participants receive anything of value. There are no witnesses signed up. I guess I could give you a layman's version of that. I believe that wants to make NCAA pools for the next next month or so legal. And so we'll contact Representative O'Brien and say, you want to bet that the bill's going to pass? Okay. That concludes testimony on House Bill 5399, which brings us to House Bill 5568, sponsored by Speaker Lima. It's an act related to cities and towns, subdivisions of land, and zoning ordinances. It provides planning board approval votes require majority of the members present at the time of the vote / quorum of the zoning review board would authorize voting members, including alternatives, as part of that majority. Let's see, Speaker Lima is not present, but there are two witnesses that signed up. The first is Jane Weidman, who is with the American Planners Association, and she is also the town planner. Okay, then we'll go to the next one, Bill Walsh, the Rhode Island Builders Association. Bill Walsh. Yeah. Billy? Bill?
Thank you, Mr. Chairman, members of the committee. Bill Walsh on behalf of the Builders Association, here in strong support of Deputy Speaker Lima's legislation. We thank her for her leadership. We also like to thank Speaker Shekarchi and the entire House leadership team and all the members here that included this important legislation as part of a package of bills this week that was really focused on housing access and affordability. The purpose here is to correct an inequity that exists between the relationship of quorums and voting requirements of planning boards and zoning boards. This inequity adds time, cost, frustration to an already onerous process and an expensive process as well. And it's ripe for abuse, available to be used arbitrarily to block different types of development. Currently, planning boards can vote to approve items by majority rule, but only in one situation, and that's when all members of the board are actually present. Because of the way it's set up, as attendance falls off, the threshold for voting to approve a proposal increases to a supermajority, and ultimately, when a bare quorum is present, a unanimous vote is required to approve something. How does this play out? A quick example is most planning boards have 7 members. Meaning a quorum is 4 people, but if only 5 people are present, you still need a 4-to-1 vote, a supermajority, to approve something. And if only a simple quorum is present, you need a unanimous vote in order to move forward on something. And so we believe that the standard is contrary to the democratic principles of majority rule and vests disproportionate power into the voice of, in this instance, a single objector. As it relates to zoning boards, the state law is a little more prescriptive. All zoning boards are mandated to be composed of 5 members. It requires 5 members to be in attendance to hold a meeting. It also requires 4 votes in the instances to approve variances and special use permits. We believe that these standards are egregious and also ripe for abuse. Similarly, the changes presented in the bill here still preserve a supermajority standard to an extent. It is a compromise, but it would greatly improve how we convene hearings and how things are voted by allowing that 4 people can convene a hearing, but you'd still need 3 votes, which is a quorum of the full body of the board. We're also supportive of the language in your files presented by Rhode Island Housing to similarly address quorum and voting standards at the State Housing Appeals Board. We believe this is common sense legislation. This will help us get the process and the time and expenses for all development to move forward. It's very important for promoting affordable housing, and so we appreciate everyone for your consideration, and I'm happy to answer any questions.
Any questions for Bill? Edie.
Thank you, Chairman. Bill, you've done a very good job of explaining the situation. I wonder if you could give us an example of what you describe as egregious behavior causing trouble.
Sure. Thank you very much for the question. I think oftentimes, and I don't want to speak to any specific project per se, but I think we've seen instances in different manners where a personal philosophy can often be used to object. In this case, you can do it through not showing up to the meeting and thus not allowing a meeting to convene. So if it's trying to block certain types of development, whether it's industrial or solar or affordable housing or just a development in general, there are chicaneries that can be played to avoid the board being able to even take up the issue. And so we just view that those are opportunities for abuse. There are many anecdotes that I could have different developers speak to in their personal opinion. I don't want to suggest how anyone participated in their process, but we feel that this is an important loophole that we want to close so that we can allow things to be dealt with on the merits.
Any more questions of Bill Walsh?
Me.
Oh, sure.
Thank you, Chairman. Bill, I just have to tell you that the planning board in South Kingstown, I know certain members are against this, and I'm sure you're aware of that. So we went through this last year, I believe, right?
Yes,
Bill?
we did.
Huh?
Yes, we did.
Yeah, we did. And they feel that that's not a majority. You're saying 3 out of 5 would make... you only have to have 4 members out of 7 if there's 2 alternates. Is that what you're saying, right? Only 4 have to be available and listening to the testimony, right?
So, if I may, in the instance that I think many of the planners are, and I certainly don't speak on their behalf, and I know you have written testimony from their association as well, what they typically point out is that because the state law surrounding how planning boards are composed, there are different variations of how this comes into play. So I believe South Kingstown has a 7-member board, and the scenario that I discussed actually provides pretty true. They're less, they seem to be addressing more of a scenario where a municipality could have a 5-person board for planning, and they have concerns that if only 3 people show up for that planning board meeting and a vote of 2 to 1 were eligible to approve, which it currently is not, they view that they don't believe that 2 people should have the right to advance this proposal, and we view that as extraordinarily undemocratic in that the single voice of an objector is holding back something. And if someone, if we're at this 3-person of a 5-member board for planning, quorum status, and we need to run the table to have all 3 people vote in this, and those other members, life happens, and people, are, pre-COVID, but before not having the opportunity to do the remote things that we do now, that it may have been a different story, but people couldn't make items innocently or for whatever reason, or if they really wanted to find ways to avoid it without being on record, they could simply not show up. And so we don't think that one person should be able to kill a project, and we certainly don't have a scenario anywhere where one person allows anything to get voted to push something through. So that's where our concerns are, is that the majority rule principle is being distorted here.
So how does this apply to the 7-member planning board, or doesn't it?
When seven under the proposal right now, if 7 people are, if the board is 7 members, current law says that you need a vote of 4 people in order to approve the project, regardless of how many show up, whether it's 4, 5, 6, or 7. So, when all 7 members do show up, there is a simple majority rule, because a vote of 4 to 3 would hold true. The problem is, as attendance falls off, if only 5 people show up, you still have to have 4 people vote for it, and that's an 80% threshold rather than a majority threshold. And if only 4 people show up for that hearing, you need all 4 votes. You need a unanimous vote, and we think that sliding scale is contrary to the processes that should be playing out in order to get through this. And as you're well aware, for major land developments and subdivisions, there's 3 stages of these comprehensive hearings, and so every part of this process gets held up, and it's not like one aspect of it is somehow getting pushed through without adequate review. I know we've dealt and discussed with the timeline that it takes to get through all these processes over the last few years, and so the time is something that's holding us back, and we really do need to be moving forward with providing adequate housing opportunities for folks in this state. We really are not keeping up with the demands, and that's distorting our markets here.
So with the 7-member board, how many have to be present to make a quorum under this bill? 4?
If 4 people show up under the bill, if 4 people show up of the 7-member board, it would require a vote of 3 people to have a majority. So a 3-to-1 vote would pass, whereas under current law, a 3-to-1 vote would actually lose.
Well, that's what they're objecting to. So, I mean, just so you know.
Well,
you're aware of that, I think. And
thank you very much. We don't think one person should have veto power over it, and that's what we find objectionable.
Thank you.
If there are no more questions for Bill Walsh, that would conclude testimony on House Bill 5. I'm sorry. Go ahead, Edie. Go ahead.
With all due respect, I don't think that this is really not respecting the democratic process. It is altogether possible that 2 members of the committee might be in quarantine, and we might not have virtual meetings going forward well as the past. It might be that 2 members of the committee are out of town on vacation, and in some cases a very canny developer could time the application for a time when certain members who are less favorable to something are not going to be in town to attend the meetings. So I don't think that we need to really decrease the number of votes to maintain a democratic process.
I agree with Edie.
Okay. If there are no more comments or questions of Bill,
just a quick comment.
Yep.
Representative Agello, can you hear me, Representative?
Yes, I can.
The hypothetical scenario that you laid out regarding timing of a zoning meeting when someone is out of town actually happened many years ago. So yours is not hypothetical.
I knew that from observation in Providence, as well as probably in more places than Providence and North Providence.
Okay. Then that would conclude testimony on House Bill 5568, which brings us to the second to the last bill tonight. House Bill 5577, sponsored by Chairman Azanaro. It's an act related to animals and animal husbandry. It authorizes the potential appointment of pro bono attorneys, supervised law students, and from a list maintained by DEM to act as animal advocates in animal cruelty and abuse cases at the court's discretion to serve the interest of justice. Chairman Azanaro is probably home asleep, so we'll go with Stacy Ober. Stacy?
Yes, good evening, Mr. Chairman.
You're on the air.
Thank you.
You're welcome.
Good evening, committee members. My name is Stacy Ober, and I am speaking on behalf of the American Kennel Club this evening. American Kennel Club is a 135-year-old not-for-profit, and we are recognized and trusted as experts in canine health training, breeding, and responsible dog ownership. The American Kennel Club, I wanted to note, is a animal welfare organization, which means we're pro-animal ownership, and we recognize the human-animal bond, the value of quality animal care, and purposeful breeding, and we support advancing science to ensure the health and well-being of animals. Our clubs have funded more than $59 million in canine health research that benefits all dogs. I want to start on acknowledging that AKC supports enforcing the state's animal cruelty laws, but we are opposed to House 5577, and that is because the bill would authorize the appointing of lawyers for animals in the interests of justice, which implies that animals have legal rights. I want to just acknowledge for the committee that courts have universally dismissed cases brought voluntarily by not animal welfare but animal rights organizations on behalf of animals for lack of standing. For example, the Animal Legal Defense Fund filed a claim in the name of a horse as a member of a class protected under state animal cruelty laws in Oregon just a couple of years ago. And the Oregon Supreme Court held that an animal lacked legal capacity. And it went on to say that there are profound implications of a judicial finding that a horse or any non-human animal, for that matter, is a legal entity that has the legal right to assert claims we now reserve just for humans. So AKC's concern is that changing the legal status of animals in this way, away from being deemed property, which is a long-standing tradition of case law and common law, could actually hamstring the ability of owners, veterinarians, and government agencies to actually protect and care for animals. And that's why we're concerned about this particular framework and changing how our court system would process these cases. Thank you for letting me speak with you this evening.
Okay, thank you very much. Is there any questions for Stacy? If not, there was one other witness that signed up but is unable to be obtained on the phone, Stephen Shea. So that concludes testimony on Chairman Azanaro's bill, House Bill 5577, which brings me to the last bill of the day. It's House Bill 5311, sponsored by Representative Edwards. It's an act, a minute. It's an act relating to mechanics liens. It provides that any arbitration award issued shall be binding in the mechanics lien action and shall be res judicata, which is a Latin word for it's already been decided. The court may award reasonable attorney's fees in its discretion to the prevailing party. Representative Edwards indicated to me that the bill spoke for itself. There are no witnesses signed up. which concludes testimony for today.
Wait.
And do I hear a motion to adjourn?
No.
Oh, I'm sorry. Jason?
I just want to point out on this arbitration bill that sure, it speaks for itself, but I'll just say this. The shunting off of disputes away from the court system into some sort of arbitration system at times has its advantages. But to sit here and say and put into black letter law that an arbitrator's award is, quote, res judicata, which means it can never be brought up again. You can never undo the finding of the arbitrator that the arbitrator's decision is final and set in stone as hard as we possibly can in a legal sense, is disrespectful, frankly, to the constitutional system that we have set up today, where the court, staffed by judges who are appointed by a governor with advice and consent by the Senate, is the arbiter, the final arbiter, the no questions asked arbiter for res judicata purposes of all public disputes. Arbitrators have a role in our system, but this bill gives them entirely too much power. Even if I were asking them to decide the issue of a parking ticket, I would never, ever, ever think it's good public policy that a Superior Court judge appointed in the way that I've described could conduct judicial review over that proceeding. That's my say.
Thank you, Representative Knight. Okay, is there a motion to adjourn in order?
Motion to adjourn.
Seconded. All those in favor signify by saying aye. Opposed, nay. The ayes have it. Thank you very much to all the members of the committee and the staff members who've been here since 9 o'clock this morning, over and above the call of duty. Thank you very much. Good night.
Good night.